online, please ensure you include your hospital at the chat box so that you can also participate in the raffle draw. Thank you. Thank you. Please, for the opening remark, please make welcome our COO, the Chief Operating Officer of Total Health Trust, a Tangerine Company, as he comes up stage to give the opening remark. Please give him a round of applause. Thank you.
Good morning, everyone. Firstly, thank you very much for honoring our invitation, and we sincerely appreciate the fact that you could join us this morning. I think I'll just start off without wanting to take so much from the keynotes as well as other discussions that will be taking place. Looking at the theme of today's discussion, quality of care in a hyperdynamic society, and I think a couple of things come to fore. For all of us who are keen watchers of the economy and the Nigerian state as a whole, inflation obviously is running at a pace that has become very alarming, and that we know also has a significant impact on medical costs and medical trends. And we all being in that same value chain, we, it is something that is worrisome, ultimately impacting cost of care. Another thought that crossed my mind also is the fact that we are all trying to grapple with the reality of emigration, japa, like we'll say. And I don't know, but for us, we have about 60 clinically qualified people, and almost every day I wake up and I'm just like, God, I hope we don't get another resignation today. So that is another reality. The third, in my own opinion, also that is, running faster than output, because when you talk of, readily in healthcare, you remember the hearts and, trying contracting at a faster pace than it should be. Another reality that we're also saddled with is, regulatory landscape. We all, looked forward to the new regulation, the NHI Act, and we're all waiting to see how that operationalizes. And we're seeing a lot of collaborations between government and private sector. And now do we all ensure that we are collaborating with the government to ensure that we achieve universal health coverage rather. Lastly, a lot of us talk about technology, telemedicine, virtual consults, the place of pharmacy chains and all that. So within all this conundrum, how do we ensure that we anticipate change, we are prepared for change, and we are positioned to ensure that we leverage all these rapidly changing um, metrics, as it were. So I wish every one of us happy, deliberations. I am also open-minded. We want to, learn from ourselves. So we would also be co-learners, and hopefully we should be living here better than we came. And once again, thank you very much.
Thank you very much, sir. For those just coming in, I'm going to reiterate, please pick up the paper that will be given to you at the reception if you haven't picked up yours. And then there's a paper in the folder. Please fill up that paper. It's for feedback, so we can have a feedback. Thank you so much.
The best friend, the best partner. A total health trust to understand ourselves. Like friendship, it's about giving and commitment. There is nothing better than a great partner with great purpose. Purpose dwells, purpose strives, purpose enriches. At THT, we look for build our purpose, working together to make Nigeria healthy. We cannot promise that life won't be tough, but you can be assured that healthcare can't be easy. You can count on kind, resilient and responsible, experienced yet modern. Resilient and responsible. Our purpose is simple. We're here to make things simple.
This is our annual provider forum. I welcome every provider present here, and I'm happy to be here with everyone. Permit me to introduce my CEO, Mr. Toyindin. I know you've seen him, but I just want to introduce him again. The head of medicals, Dr. Eitayo Abejide, Dr. Godwin, the medical director of Healing Stripes Hospital, and other distinguished ladies and gentlemen present in this occasion. We welcome you all. Thank you. I hope my slide is there. I'm not doing a presentation. I'm just trying to do an opening remark, just touch theme of the forum. I don't know if everybody is seeing that. Can you see that? Okay, so what is our provider forum all about? Our CHE product forum is a yellow forum where we meet up with our providers. What we do here is to interact with providers from the system, and then we'll make an improvement for us to forge better. So looking at THT, I termed it THT and you, because I know it's a partnership between THT and the providers. So we, THT, we've been around since 1998. At least we are the first. And healthcare, when you talk about healthcare, I'm going to talking about healthcare, is an organized provision of services, healthcare services to individuals. So you talk about quality, you talk about healthcare, and we talk about quality healthcare delivery, which is exactly what we are discussing today with our providers. So we say quality care delivery is the provision of health care to a group of individuals and population with the intention of having the likelihood of a desired health outcome. That's good health outcome. And for you to have a good quality health care delivery, because I won't repeat good, because like I said earlier, I said quality, I look at it as something good. So we have to talk about quality. So for quality healthcare delivery, I termed something, there are 6 building blocks of quality healthcare delivery. And for providers here, just for you to remember, I use a word, a mnemonic, SET-P. If you look at it, I say S-E-T, then P. So you are setting out to ensure that you provide good healthcare. First of all, number 1 is safe. It has to be safe. For you to have a quality, it has to be safe. Being safe means that you don't cause harm to your patients. There are some hospitals that people, when somebody wants to go there, another person will come up to say, please don't go to this hospital. The other day, they forgot needle inside somebody's body. The other day, the environment is dirty. In fact, you shouldn't, they tell us in medical school that you shouldn't leave a patient worse than the way the patient visited you. So your care must be safe, that everybody would want to come there. Then if you talk about the second one, which I termed efficient, it has to be efficient. And when you talk about being efficient, it has to be something, it's something that it's a practice that you have the right people doing that. Something that when you give it to somebody, the person is doing well. Then you talk about, I said, you talk about time, you have to be timely. Because when people come to your hospital and the waiting time increases, it's actually a problem. People should not wait too long in a hospital. So you should find a way to make sure things are there. Then you now talk about the P, patient-centered. What we should do should be within the needs of the patients. Patients come to the hospital, you should take time, the doctor should take time, like the patient, find out what happens to the patient, make sure the patient is happy, because most of the time people come to the hospital, the reason they're in the hospital is not necessarily because they are sick. Actually, it's like health. You said not have sense of this, there could be other things, could be socially. So a doctor should be somebody that the patient is able to confide in. Because I was somewhere, I wasn't even consulting. Someone saw that I was a doctor, I don't know her from Adam, she just said she came to me. She started crying. So I think there was something we used to check BP around. I checked her BP, it was about over 200. I said, madam, you need to get to the hospital immediately. She said, what? She started telling me her problem. She has a problem at home. And with that, I cancelled her, I directed her. So it's not just, I didn't provide health care in quotes for that person. But at the end of the day, I made sure that the patient was, as in she was happy. So that is what we are talking about. It should be patient-centered. Then the third one is equitable. You don't discriminate people in your hospitals. They say these ones are HMO patients, because I see people who say, HMO patient, HMO don't pay. But I will tell you that most of the hospitals that are thriving well in this country right now, the way it is, because they are all from HMO. And some people will sit down there and say HMO is not working. In all honesty, if you say it's not working, it won't work for you. I can give you an example of a particular provider that I visited some time ago. He told me about his clinic, how he started small. And he has a friend who had a bigger clinic. He told the person, let us tap into this HMO. That one said HMO will not work. It doesn't work. And he started off his own. By the time he knew it, he blew. He bought a building. He bought the next building. Became a very big one. The provider is in this Lagos. And the other provider, who was a bigger person, patients, they were all running to where their HMOs, because a lot of people are getting to HMOs. So you can see this person said it won't work. Of course, it didn't work for this person. The other person said it will work. Of course, it worked for that person. So that's what some people here will say HMO doesn't. I will tell you the truth. There are a lot of providers here that will come today to tell you that HMOs will work, and they will definitely work, and it will work. So that's why we said you need to be sure of what you are doing, what you are interested in doing. So equitable is there. Then you now talk of being effective. What I mean by effective, trying to maximize your resources in order to make sure you produce good health. Don't waste. A lot of people waste both material resources, their wastage of both materials, human resources. You bring in people, you don't bring the qualified people to do that, and that they waste your money. At the end of the day, when they don't get your claims right, you come back to tell us that HMOs are the problem. So I'm just saying HMOs are not the problem. So, sorry, just give me a second. So I'm not seeing my slides, so I just want to be sure of where I am. Okay, so I've spoken about the 3 keywords. The next one is hyperdynamic. I'm sure when I say hyperdynamic here, a lot of doctors will start talking about, because it's in medicine that I know we talk about hyperdynamic. When you're talking about increased muscular activity, when something is at rest, you see the muscle jumping. That's actually hyperdynamic. But in the context of what we're talking about, it's the same thing. But you see our environment, everything is increasing every day. We don't even have control of it. You and I are sitting down here. By the time we go here, you hear that inflation has gotten to 26%. It has gotten to this. Price of drug. I bought a drug some time ago, 10,000 naira. I went to buy it again, and they told me the drug was 30-something thousand. I sat like this. The next thing, it will be this price. So our society is actually in a hyperdynamic state. And that hyperdynamic state has affected majority of the things we do in the country, and that is why we have brought this topic today. But so it has actually brought everything to a, let's say, disarray, disorganized state. People don't understand exactly what they are doing. So, and that's why, and this has also affected the 6 building blocks of healthcare, like service delivery, health workforce. You see the Japa syndrome. It's actually the health workforce, the doctors, the nurses, that we provide good health care in the country. So you see that there is a Japa syndrome. Every day you employ a nurse. The nurse will tell you, come the next day and tell you they are going. Employ the doctor the next day, they will come back to tell you they are going. That is what keeps happening every day in this country. So the health workforce is there. We'll talk about access to essential medicines. They are not available. The small medicines that ordinarily the average people can afford, like I said, they are all going up. Health information system, we don't have data. And the reason we don't have data is that we keep changing people. Probably you get somebody in the hospital, the person leaves without notice, no handover. So we don't keep those data. We don't have enough data. Then you talk about funding, financing. Like I said before, HMO, health insurance, is a sure banker to financing as we stand now, whether we want to agree with you or not. In the next 200 years, we'll still meet health insurance. It's been there in HE. So funding is a problem because not much people are even funded. More people have health insurance. We have less than 5% of Nigerians who are insured. Then leadership. About last week, I learned that they changed the Ministry of Health, right? So you can see how leadership is a Minister of Health is affecting us, because if the Minister of Health, the last one, had a policy that was helping everybody, and it goes. And that one brings another policy. So you see, changing in policy is also a problem, and it can also increase that. So what are you talking about? In all this, how do we navigate that? It's a question I want to ask everyone. I'm sure you're seeing my slides. We need to start thinking, how do we navigate through all this? And that is the reason why we have gathered personalities, professionals today to come and tell us how we navigate through this. And like usual with the THE events, I'm telling you that we are going to have a lot of exciting activities, from the keynote speaker to the panelists, with a lot of freebies to be won, including raffle draw. You can see things behind us. But I assure you that THT is still THT, and we'll keep making Nigeria healthier. Thank you. And I also want to use this opportunity for people. They're going to be flashing our contact lines, our communication line on that place. So you can also copy if you want to copy. So you see provider management, everything, because most people will tell you they don't understand. And while we are still in this program, you'll be having the head of claims, head of case management. They'll be at the back. If there are questions, provider managers are at the back. You can easily go there and answer the questions. Thank you. Once again, welcome you to THE Provider Forum. Please wait and see a lot of goodies coming out of this program. Thank you.
All right. Good morning, everyone. Make no mistake, there has been a lot packed in what Dr. Chianka delivered. So please let's put our hands together once more again. I believe that she has set the tone for today's session, and we're going to hopefully have an amazing time together. First and foremost, I would like to just reiterate as to why we are gathered, and I might even preempt that by introducing myself. I'm Dr. Timile Yogukoya. Fumi had introduced me earlier, but this is me just putting a face to the name, and I will be co-anchoring with the beautiful Fumi throughout the course of today's engagements and interactions. So once again, please put your hands together for yourselves. I must say that it's a delight that we didn't have to start by 11 or by 12, and the only way we could have been able to do that is because everyone turned up, and you turned up in numbers, and you turned up early. So once more, please put your hands together for yourselves. Amazing. So to just quickly mention, for as many of us joining virtually, please kindly confirm that you can see, you can hear, and that you are fully part of all that is going on here. We want to make sure that as much as possible, no one is left out of the conversations and interactions that we're going to be having today. Because at the end of the day, we want you to walk out of this hall feeling special, understanding that you are a part of our success story, and that hopefully together we're going to be able to do great things at the end of the day. All right, so for everyone joining virtually, please kindly confirm that you can see and that you can hear and that you are fully part of all that is happening. If there are any issues, I believe that the team on ground is more than capable to sort it out and attend to any of the technical glitches that we might be having. How many of us remember what Dr. Chianka said about set P? This is me just checking if we were listening. So she said the S was for what? This might be the beginning of the raffle draw. This is how we know whether you will live with gifts. So the S is for what? The E is for what? The beauty about chorus answers is that people that don't even know can blend in. So the S is for, the E is for, the T is for, time or timely? Timely. The P is for what? Then the other E is for, then the last E is for. Amazing. You have done very well. Please put your hands together for yourselves. It's only the people that we're talking that are putting their hands together. So let's put our hands together for ourselves. All right, amazing, amazing start to today's session. It gives me great delight in furthering today's forum in bringing up the keynote speaker. I will just quickly walk us through his person and help us to be better acquainted with his accomplishments and the pedigree that he's bringing to today's conversations. Dr. Chinaka rightly said earlier when she was introducing, in mentioning that we're going to be having brilliant minds come off stage. And that is one of the brilliant minds that we will be having. So today we're going to be having Dr. Adeolu Arogundade. He's a medical doctor of the Lagos State Accident and Emergency Center. He's a trauma room doctor with a master's degree in global e-health from the University of Edinburgh. He is also a dive medical professionally trained from the University of Stellenbosch in South Africa. He holds a health management certificate from the Enterprise Development Center of the Pan-Atlantic University and multiple leadership and management certificates from the University of Washington. He serves on the Standard Organization of Nigeria's team to the International Organization for Standards Health Informatics Committee and the local National Mirror Committee. He's also a member of the Lagos State Digital Health Core Strategy Team. Dr. Arogundade is the current president of the Society for Telemedicine and E-Health in Nigeria, and he also serves on the executive board of the Hyperdynamic Medical Practitioners Society of Nigeria, HMPSN. With a very warm applause and an ovation, please let's welcome Dr. Adeolu Arogundade.
Good morning, everybody. It's indeed a privilege and an honor to be speaking to us this morning. I welcome every one of us, and I trust that we will have a good time. I personally believe that it's an auspicious time to have a gathering like this. I personally believe that for healthcare to get better in our country, we need to get together from time to time to discuss the issues that concern health. You see, healthcare is no longer the way it used to be. A lot has changed. And to be able to meet up with the demand that is on ground, we need collaborative discussion. Particularly, I'm also glad in that some of these discussions are coming from an insurer of health. And I want us to put our hands together for what THT is doing. So I know what they are doing because in my facility we have partnered with them on a number of occasions, and I know some of the things that they have done. Just sometime earlier this year, there was an effort to raise about 500 units of blood to be donated for free to Lagosians. And THT championed that cause, and we were able to make a success of the event. So put your hands together for them. All right, so today I'll be speaking to us on the quality healthcare delivery in a hyper-dynamic society. I don't think it's leadership, and we saw a lot of other things that she talked about. So I'm going to start by talking about quality, and I'm not going to dwell in it because I believe she said a lot in it already. We say quality is the degree to which health services for individuals and populations increase the likelihood of a desired outcome. And I say that if you, in summary, quality is the level of value that you provide. So what level of value do we provide to the people that use the healthcare services that we deliver? Will they say it's something that they want to that can compare to what is obtainable outside the climes of Nigeria? So some time ago there was this thought that anything that is associated with Nigeria, you cannot put quality to it. And many people believe that Nigeria is far from quality. But I beg to differ and say that the narrative is beginning to change. And we are beginning to see some of the best healthcare facilities in Africa spring up in Nigeria. So I want you to be hopeful, and I want you to know that it is achievable. It might be a daunting task, but it is achievable. So, sorry, I don't have control of the slides, and I'm not seeing where the slides are. So it makes it a bit difficult for me. Or if I could just have the control. All right, let's go on. So the slide that you have now talks about safety, the qualities of safety, and I was so impressed that we're all able to recite it. It means that we all have the basics of what it takes to implement quality. We all understand safety, we all understand effectiveness, patient-centeredness. But some of these things have deeper meanings than what we already think. Around the world, if you went to things are beginning to change and look different. If you went to a hospital in Nigeria, before now, you will get medication, somebody will give you some medication, and then they tell you, go and take this. And many patients, many people don't even bother ask, what is it that you have given me to go and take? Sometimes our practitioners are very interesting. So they take the medication out of the packet. They put them in sachets, and then the sachets are not labeled with the names of the medication, and they just hand them out. Recently, I had a very interesting experience like that. So you can imagine that I'm a medical practitioner, and I've seen a specialist who took the cream out of the tube and packaged it separately. But I realized, oh, they didn't mean bad. You know, they just wanted me to have the original, and they had added something else to it. But it's not uncommon to find people just packet it for the patients like that. You know why they do that? So that the patient will not go and buy it outside. The patient will come back. But that kind of act is against the principle of quality. Because quality says it has to be patient-centered, just like we recited here now. Now, there's a new move now. People are saying that for desired outcomes to happen, we must have what they call patient engagement. It means it's not like old time where the doctor is God, and then the patient comes to him, and he says, take this. And the patient cannot question what the doctor is saying. You take it like that, you go and take it the way I've given it to you. If you have other problems, you come back. No, the patient wants to know what they have. The patient wants to know what are the options for managing what they have. The patient wants to be the one to decide what they do about it. They want to know the side effects of the drugs, but they want you to tell them, so let them make the decision. But how do they know side effects, even if they don't even know what the drug is? So, all right, thank you very much. So, I'm just trying to talk about quality. Patient-centered care means that the patient should be part of the care that they receive. And we cannot talk about quality care if we have not done that. And then we talk about timeliness. Timeliness is not just that, yes, the patient can have access to, it's not just that the emergency room is there. I remember some years back, I had an auntie that was ill, and she was sent for an investigation. And she was told to come back in 3 months' time because they had put her on a queue. In 3 months' time, she was dead. So that's not timely care. And these are some of the things that we find when we talk about patient quality of care. I don't know if I'm on that slide, but I have a quote that really got me thinking, and that's really what I want to dwell on today. That quote says, the health system in most nations will have to treat proportionately more people with more illnesses using relatively fewer tax dollars and workers. That statement was from 11 years ago. It was from an Australian politician who was the treasurer for the Australian government. And at that time, he was looking at the resources that was available for healthcare, and then he made that statement. And I just ran into that statement and I found that it's, as old as the statement is, it is still more than 100% correct in our situation today. Healthcare system in most nations will have to treat proportionately more people with more illnesses, relatively fewer tax dollars, and relatively fewer workers to do the same thing. So, sorry, these slides I have, I don't know, I can't see what is happening. Yes, what I suspect that the slide I have on this is the old slide. I don't know whether it's the one that is showing. Sorry, can I see the previous slide to that? Okay, so this is the old slide. This is the old slide. Just a minute, please. So I was talking about being fascinated by this statement that I ran into some days back, and it inspired me to think about, how much does this correlate with what we have in our country today? And I decided that I was going to anchor my talk on it. So, if you look at that statement, it says, we will have to treat proportionately more people. And that is not difficult to imagine. If you look at Nigeria, for example, you can see the trajectory of our growth. We are one of the fastest growing nations in the world. And that's just for Nigeria. If you talk about Lagos State, even though we are saying brain drain, you know, until fuel scarcity increased, traffic was increasing. And then you ask yourself, if everybody was leaving town, running to Canada, how come traffic is still increasing? So the brain drain factor did not pull as much weight as the fuel price hike factor on our traffic. But the point is that even as people are leaving the shores of Nigeria, you'll find that some other people are migrating from the rural areas and from other parts of the country into Lagos. So even though it seems people are living en masse, the population in Lagos appears to be growing. So whether we like it or not, we will have to plan for continuing growing population. So whatever the population of Nigeria was 10 years ago, we have to use more money. I mean, relatively the same amount of money, but inflation has crept in. So we have to also plan for the healthcare of those much more people with relatively similar amount of money. I don't know if you get what I'm trying to say. I don't know what your salary was 5 years ago. I don't believe that the people here are stationary, have any stationary amount of money. But think about what your salary could do 5 years ago. Think about what the purchasing power of that same, the value on that same money 5 years later. Now think about the amount of people that you now have to cater for. Some of us that were not married 5 years ago, we are married now. Some of us that were married 5 years ago, we now have more children. And things like that. So the population definitely has an impact on how much we have to spend. And that's one of the things that we are going to have to deal with if we're going to make an efficient healthcare system. The population is growing, but the revenue is not growing at the same rate. Okay, so he also talked about more illnesses. He said we'll have to treat more illnesses. And for those of us that keep track, Africa and a good part of Nigeria, I mean, Nigeria used to be known for managing infectious diseases. We used to talk about diarrhea disease every day, and we talk about malaria, and we talk about sleeping sickness, we talk about typhoid. And if you were sick in Nigeria some years back, if you were sick, I can take an hazard a guess here that people here know what was wrong with you. It was either malaria or it was typhoid. And that was the vast majority of what we treated in our hospitals, infectious diseases. But today, if you hear somebody is sick, you're not thinking that much of malaria. I think, short-term hypertension. If you drive through Lagos traffic for 1 year, you will have hypertension. And then I can bet every one of us here will know a friend, a family member, a colleague that has had cancer the last 5 years. You will know somebody that is... all right, nonetheless. So the point is this. We were known for infectious diseases. The interesting thing is infectious diseases are not that hard to manage. If somebody had malaria, 3 days course of anti-malaria treatment, it is over, isn't it? If somebody had typhoid, at worst, give them one week treatment. If it is the hard one that, the way they describe it, manage it for 14 days, they are fine. But if somebody has diabetes, how many days are we treating? It can't be forever now. Nothing lasts forever. Okay, it can be lifelong. Okay, maybe I picked the wrong non-communicable disease. What if it is hypertension? What if it is hypertension? Is it till death do us part or we manage for 3 days? Sorry, and when I say till death do us part, you know that I'm joking. So, and that's how it is in reality. So we are moving from diseases that can easily be managed in 3 days, in 1 week. We are moving to diseases that is what they call myeloma last. That is competing with your life. That you have, even if you are not taking medication, you'll have to, for most part, this is the slide, you'll have to, for most part, pay attention to your health care. You'll have to, for most part, either see your doctor, check your one vital sign or the other on a regular basis for the rest of your life. So, people found that when you have a non-communicable disease in one family, the cost of care on the average is over 122,000 naira. Over 122,000 naira is the average cost you're going to spend on your health care. That's if one person in the family has a non-communicable disease. And let's assume it's a mild one that does not require radiotherapy, chemotherapy, and surgery. So, and that's about 24% of the cost of feeding of that family for 1 year. So people found that if you have a family that has, an average family in Nigeria, that has a non-communicable disease amongst one member, that family is moving very close to poverty. But quality care says we should have effective treatment. It says our treatment should be timely. So, what are the principles of quality that we can apply to minimize this? Because when it is all said and done, it comes back to health insurance. If you are the insurer, you are going to have to be paid. Even though we know that right now in the country, the percentage of people that are paying out of pocket far outweighs the percentage of people that are insured. And then most of the non-communicable diseases are paid for out of pocket. So, if you look at, you said fewer tax dollars. our health expenditure per capita. Look at the trend. At one time it was climbing when Naira still had a lot of value in it. But it got to a point it started dropping. Right now, our health expenditure per capita is about $70. And if you look at this, compare with the rest of the world, the US spends about $10,000 on one person in the country, even though we also know that it's not necessarily an indication of how effective the treatment is. But the point is that that's how much is spent on healthcare. And look at the United Kingdom, $4,000. And then look at some of us in Africa. If Mali has 30. Now, what I should also mention is that how much is spent on health, that correlates well with life expectancy. If you look at the graphs, you will see how the life expectancy is. So if you want to live longer, we have to be richer. All right. So, but how much does healthcare on the whole contribute to the GDP of Nigeria? One of the lowest. Everybody says health is wealth, health is wealth, health is wealth, health is wealth. It's not showing on this graph. It's not showing on this graph. You see that health is wealth, but to us, we are not taking it like that, or we have not found a model to make it to work efficiently. Because all the expenditure in Nigeria, only 3% comes from health. And if you look at the trend from 2007, 3.9, that's small. Even when things were not as bad as this. And today we have 3.38. So health is wealth, but how much of healthcare, how much of it are we doing that is translating into productivity for the country? Because it also says how much value we're able to generate out of healthcare. So we talk about the business of healthcare. So it means all the business all of us are doing, raising capital here, raising premium here, collecting money from patients here and there, is not amounting to anything significant in the gross domestic product of Nigeria. It's not. So he also talked about, he said fewer dollars and then less workforce. So this one, I don't need to say much about this one. All of us are aware of the jackpot. If you are currently not on your way out, then you have a friend that has just left, or a cousin that left last year, or you know the way it is, and it's a big issue. Just yesterday, a patient was brought to our facility, and they said, so we had to bring the patient here because the person that does the particular investigation in that our facility has just jackpot. So we said, let's quickly bring the patient here so that you can do this investigation for us. So I want to just jackpot now. In fact, what we now found out was that it was that same person that was covering both of us. So the shortage was so bad that one person was managing two facilities. Now he has jackpot. So it's not only him we are missing. Two facilities are missing him. So that's the enormity of the problem. Some of us will remember last year when the CMA in UCH shouted, cried out for help. That 600 staff, clinical staff, just vamoosed. ARG said that they only have 9,000 doctors left on their roster. So we know how it feels. Recently, last week said they had 150 nurses left, one institution. Not one city, one institution. So that you understand the impact. I know a state in Nigeria, and I will not say the name of the state. They have less than 5 doctors in that state. So if this jackpot is happening, don't let's shout it out. I don't know whether they have doctors left here. Now, think about the health of the people that live in that city. Think about it. Recently, the Ministry of Health decided, no, let's do mass recruitment. And when Lagos does recruitment of healthcare workers, it's amazing. I get phone calls, sometimes I get phone calls, from as far as Gombe. Yeah, they are recruiting in your, please, when is the date of it? I didn't even know they are recruiting. They are recruiting. And so people come from all over. So the Japa started in Gombe and all the other places a long time ago. It's just that the effect is just hitting Lagos now. So recently they conducted an interview, and I was amazed to hear that they had openings for radiographers. Okay, before this one, the one they did before, I think they said they had about 19 openings, or they had 19 radiographers apply. By the interview date, maybe only 5 showed up. So they said, okay, don't worry, we've recruited all of you. Just come on board. Come and take your letter. One person went to take the letter. And then the one person that took the letter did not show up. So that's the depth of the problem. Very recently, Lagos State tried to recruit healthcare workers, and they had more slots than the people that showed up. That's not news. People that do residency training is now, I saw a residency advert yesterday. They said primary is not required. I didn't know that could happen in Nigeria. You will have attended refresher course. You will have spent your salary for the last 3 years attending refresher course before you will pass the primaries. And then after you pass, you now start hunting for who will take you until your primaries expires. I had a friend who did 3 primaries. So when he went to the interview, he said, there's no thing for this one. He pulled out another primaries. You know, he had multiple. So if you tell him there's no space in obstetrics and gynecology, okay, I have surgery. There's no, okay, I have medicine. Which ones do you want? Now they are saying primary is not required. Just come. And even at that, they're not getting people. So now think of all these things I'm saying. I'm talking about healthcare providers. How about from the patient perspective? I get a lot of calls from family, from friends who say, I need to see a gynecologist. I need to see this one. I say, okay, don't worry, let me call my friend. Now call the guy. The guy's in Canada. Okay, let's call another one. Then it got to a point I realized I don't even know any specialist that is on ground anymore. All the people that I thought, we all came together, they're all gone. So, more people to treat, more illnesses, less funding, less workforce. And if we go on, you'll see that we have dilapidated infrastructures. Our structures, most hospitals in Nigeria, even in Lagos, are not built for purpose. We're not designed for the purposes that they are being used for. Recently, I saw these statistics. Lagos has about 3,000 hospitals. So I said, hey, Lagos is doing well. Lagos is doing well. We have 3,000 hospitals. That's the largest in Nigeria. The nearest state had less than 2,000. So we are at least 50% more than, so we are doing well. Then I saw another graph that showed Lagos is about like number 17 in hospitals per 100,000 population. So with all our 3,000, we are far behind states like Nasarawa. Actually, Nasarawa has the highest number of hospitals per 100,000 population. Because there are not many people there. So I hope you see the enormity of the problem. Now, as you are seeing it, I hope it is not that you are thinking, this problem is big, how do I run away? You should be thinking, how do we solve it? Because if you run away today, you can't run away with all your family. You will run away. Your husband will go. Your children will grow. Your mother will go. Your father will go. Your father-in-law will go. Your mother-in-law will go. And you now start planning for your aunties and your uncles. You can't move your whole family. So the better we all start looking for how to build it, the better for us all. Some people, one time I told if I said, look, you people cannot run out of Nigeria. And now turn me to the one you'll be calling to began. No, that's not. If you want us to, if you are complaining, come back, let's fix it together. So, the problems are enormous. We can't finish talking about them. There's an energy crisis. I got one message yesterday. I laughed. One person, one director of a hospital, he got some millions and he paid it to this oil diesel supplier. And he felt, at least for the rest of the year, I managed to raise the money. So now I can just be calling for diesel when I need it. And he sent a message, and the supplier sent this message to him. Let me read it. It said, with reference to your statement of account that we sent earlier, your balance with us is 132,000 naira. Such that as such can only accommodate 127 liters. That's the person's budget for diesel this year. He says only 127 liters per day he can manage. And he says they run 127 liters per day on their generator. So their budget for this year has finished. He said on account of the current rate of diesel at 1,040 naira per liter. This budget was probably made when diesel was 700 or 500 or something. So see the inflation that caught up with them. So they were using diesel, they were just enjoying diesel. They didn't know that they were at the terminal date of their consumption. So that's where we are. The effect on your bottom line cannot be quantified. So imagine that power was not as expensive or has hard to procure. How much would your revenue be? I mean, your return on investment. Those are things that we need to talk about. The National Primary Healthcare Development Agency made one statement sometime last year. Everybody almost crucified them. They said more than 70% of drug dispensing in Nigeria is substandard. And I don't know whether, I think maybe they backtracked, I don't know. But for them to say that, tells you that the problem is significant. I don't know how much it is, but it's all part of the problem. So you treat your patient and the patients are not getting well. What part of quality healthcare is that? So those are the problems. So how do we face them? So I propose that since we have not traveled out yet, since we have not jackpot yet, we should put on our thinking caps and decide to find a way to solve this problem. You know why? If we don't, it will catch up with us. I don't know if you have been sick before in Nigeria. Is that you must have been saving a lot for it not to run into poverty, or you will die from the frustration of how bad the healthcare system is. And not to say it's all bad. I mean, those are things that can happen to you. I remember one incident that happened a few years back. Many years back, I was the medical director of a healthcare facility. And my son was playing football, and then he broke his leg. So I grabbed my key. Let's go there, let's go. I carried the boy. Then when I got there, I remember, there's no power, there's no water. So I drove myself back to the house, took him back upstairs, and then went to look for POP to buy, to do the thing in my house. What if I didn't know how to do it? So whether you like it or not, you have to sit down. You will confront it one day. If you don't confront it yourself, you have families, you have friends. There's a good chance that one of them will need significant healthcare solution somewhere along the line. So why don't we sit down and begin to think? And I know some of us will say, we have answers, we have answers. It's just those people at the top. They don't know how to solve problems. If you have answers, start implementing it where you are. And let us all begin to learn from what you are doing. Because nobody argues with success. If I see your facility working, I will come and say, we all borrowed 100 million from First Bank. You have paid your own, you are now getting a return on investment. Me, I'm still, so I want to learn from you. All right, so there's another wonderful professor, Sierra. He said, if healthcare is to flourish in the coming settings, and he said this more than 15 years ago, that if healthcare is to flourish in the coming setting, of diminished resources and increased demand, then it will do so because we have explicitly designed and implemented new systems of care that are fundamentally sustainable. And one of the things it preferred was technology. And I'm glad that today we have technology solutions that can begin to answer some of the things that we are talking about. So my first suggestion is to ride on the back of technology. Technology can improve our efficiency. Technology can allow for transparency. Technology can help us to reach the people that have been hard to reach. And if there are things that we all must start thinking about now, we should start thinking about technology. And make no mistake, technology on its own cannot solve problems. In fact, in Africa and most of the lower medium income countries, technology has run some of us down because we did not learn how to implement it. So you take the already scarce resource and then opportunity cost, you take it from managing diarrhea disease and you go and buy a set of computers that you don't have power to maintain. There's no generator. You buy the computer. You now have to go and look for diesel to keep it running. So it has to be implemented in an efficient and effective way for it to make sense. And that's one of the things I propose. I propose that there are people that have learned these solutions. There are people that they have gone through the learning curve. There are simple things that we can do that are sustainable, that we can begin to leverage on. mHealth came. Look at Nigerian population. We have one of the highest internet penetration in Africa. Mobile phone penetration in Africa, highest. Can we leverage on it to accomplish universal health care coverage? We have telemedicine to people living in remote areas where a dermatologist, for example, is not available. You can actually see a dermatologist in a village in maybe somewhere in Oyo State. You can see a dermatologist in Luth. These are all things that are possible, but we have to get it right. Recently, you have AI coming on board. Some of the hospitals, some of the laboratories where we used to do investigations, if you go and do an MRI or CT scan, you wait 2 days for the radiologist to review the results and send you a report. But today you have AI that can actually read the radiology right there as it is being taken. And as they are handling you, many of us here have Fitbits or some step trackers that we use to track our movement. So when you flash a dashboard and you see how you are performing, there is a correlation, that there's evidence that you will try to adjust by yourself. If you're able to see, oh, I checked my blood sugar in the morning and it was reading so and so, there's a likelihood that it will affect what you eat next. Not 100%, but at least it will improve what you eat. So there's something called patient ear. We can leverage on it, and it can help us to address some of the issues that we have. Running out of time. Out-of-pocket payment is one of the big issues we talked about. So health insurance is something that we are missing, and our percentage uptake is very low. 40% of Nigerians live in poverty, so how do they even pay? And there's this study that found that out-of-pocket payment increased poverty by 0.8% every year. So just for paying for paying from your pocket. And then we have THT coming up. So we have to encourage ourselves. And when we talk about businesses, one of the things I've learned to realize is that you have to help the people that are doing business survive in Nigeria. Otherwise, we all fall together. We have to help ourselves to survive. If you say, oh, they're a competition. If they go down, you will ultimately go down. And I found that when it comes to health insurance, healthcare providers are also complicit. So you have some workforce, they have insurance, they have a retainership with you. So they come back at the end of the month and say, Oga, I didn't come at all today. Just write something for me, give me 5,000 naira, and let the insurance cover it. So all of those things make it difficult for them to survive. And then we think that We are helping ourselves, but we are actually destroying the system, ultimately. So there's also beautiful thing, compulsory health insurance is coming soon. National NHIA has made health insurance compulsory. Lagos State is coming up with a executive order. Everybody that lives in Lagos must have health insurance. Those are things that will help us. And there's the Basic Healthcare Provision Fund for the vulnerables. So if you know anybody that is vulnerable, send their details to LASHMA. LASHMA is going to register them. I don't know if THC has any program like that, but there is a fund that is made available by the federal government. 1% of the consolidated revenue is going to go towards taking care of them. And if some of these things work, then we will all have less to deal with. So, health and wellness. So why do we have to treat people, make them sick, when we can prevent them from getting sick? And if we prevent them from getting sick, we don't have to spend all of that money. And I see some of the things that THT is doing. We must all start engaging in all of that. How do we improve our health? How do we stop ourselves from becoming sick? And then patient engagement, I've said a little about this. And then, posturing for, so all of the people that have jackpot, that left their father and their mothers in Nigeria, they now call. They're earning dollars, pounds. Can we leverage on some of the money that they send back home into a pool that can sustain healthcare in Nigeria? And that's what this is basically about. And then we also have to improve our capacity to manage organizations. Whatever it is we did in the time past, the situation now is calling for change. We have to be efficient. We have to be deliberate. We have to decide what works and does not work, what does not work, and then leverage on all of that. Thank you very much. Eriko says, given the likely enormity of the task, it may require nothing less than a reinvention of health system. It will require nothing less than a reinvention of the healthcare system as we know it today. And I'm glad to let you know that people are already undertaking that endeavor. Thank you very much. Have a beautiful night.
Thank you so much, sir. Let's put our hands together once more. I believe that was articulately communicated, and it should stir some conviction in our hearts and in our minds that we have a problem glaring us in the face and we have to solve it. Do we have an agreement that we have to solve it? Are you sure that you don't have plans? All right, so thank you so much, everyone, for staying with us up until this very moment. We're going to take a 15-minute session to ask questions from the keynote speaker. So we're going to create that opportunity in a few minutes. We will like to take some ads in terms of videos being showed in the next 5 minutes, and subsequently we will move into a few other things. To just announce to us that for everyone present as a provider, as a hospital, as a facility carrying out one service or the other, should you need to speak with the claims team or the case management team at THT, we have representatives at the back that will be willing to engage with you, and we also have the entire provider management team as well around to ensure that whatever concerns or issues that you might have, it will be taken and attended to as quickly as possible. Our goal is to make sure that when you are leaving here, you are happier than you came. All right? Very simply put, that's what we really want to achieve, is that if you are happier, we know that the members, the enrollees, will be happier. Am I right? So that's the goal. So please, if there's anything that you would like for us to attend to, please do not leave this forum without having us attend to it. That's why we're here, and we're delighted to be able to take that. We would also like to kindly recognize and appreciate the presence of the regulators. We have representatives from the NHIA with us. If you don't mind, please kindly indicate, signify where you are, so that we can just quickly acknowledge you. Thank you so much, Ma. Thank you so much for being with us. It's a well-rounded table, so everybody is present. We have every single stakeholder in the room this morning, and together we're hopeful that we'll be able to take all that needs to be done to account.
So please just put our attention to the screen very quickly.
All right, I'm quite certain that these glitches will be attended to, just so that everyone can. All right. Thank you so much, everyone. That was just to help us to see that beyond attending to just ill people, we do a lot more than that. For us, we are committed to ensuring that as much as possible, we're able to partner with as many people as possible in ensuring ultimately that we can make more people healthier at the end of the day. In furthering today's session, I have the unique privilege of introducing, remember that I said earlier that it's a round table, so everyone is present here. And we will be taking some feedback, perspective, and also insights from the client's point of view. And joining us today in today's forum is Dr. Jato, the medical consultant for Stanbic IBTC. Please let's put our hands together as he comes to address us very briefly this morning. Let's jam those hands together if they are not too busy.
Good morning, colleagues. It's a great pleasure to be here and to just speak to us. I specifically asked that I be given this opportunity, and I want to appreciate THT, the Tenjare Group, for giving me this opportunity. I speak here as somebody who has played in the theory aspect of healthcare delivery. At the point I was a service provider, a hospital like yours, who offers medical care to enrollees on various HMO platforms. At point, after doing that for about 7 years plus, I came into the HMO space. And I was in the HMO space for about 16 years. I worked with one of the pioneer HMO in Nigeria, that's Medexia. And I rose up to the level of an assistant general manager there, quality control and provider management. And currently, after that, I'm now in the other third arm of the entire circle, which is the client. I currently work with Stanbic IBTC as the medical and well-being consultant, which I've been doing for the past 6 years. So if I say I understand how this plays or works, truly I do. But what I just want to speak to us briefly about is that it's a partnership, and we must continue to see this relationship from the partnership point of view. Not from the point of view that they are HMO, we are the hospitals, and therefore it's business. HMO, do your business. We do our business. Because when we view it from that, then we are not able to provide that synergy that this partnership should do to deliver quick, effective, efficient health care to enrollees who are your patients. Every enrollee that walks into your facility is your patient. If you see it from that point of view, then providing care and your duty of care becomes very paramount in the way you deal. Why am I saying who are enrolled on my HMO platform? I have 2 HMOs that currently provide services for our employees, which is Liberty or THE and AXA Mansai. So when they walk into the hospital and they are saying, oh, HMO patient don't come again, you know that they have a duty of care to ensure that quality, quick, and efficient service is delivered. And that is why sometimes complaining bitterly, because the way the doctor attended to her gives the impression it is Liberty staff, enrollee, it is Liberty patient. And eventually, this patient has to be referred by our HMO to another hospital that hospital displays. So I want to encourage us to see this as a partnership. Our keynote speaker talked about the fact that for sustainable healthcare delivery, you cannot depend as a facility on what cash-paying people will come into your hospital and provide for you. The cash flow, the patronage that is sustainable will be that which you are getting for compulsory health insurance. I know in our typical Nigeria setting, it's going to take a long while before it becomes implemented, and implemented on a continuum basis. And I'm sure what Lagos State is doing with what I hear Ogun State is about to start commencing, and maybe if I know such a plan has done very well in Delta State, because it's my colleague and we graduated who has the Delta State Health Insurance Scheme. That is what will sustain us. But please, my plea from the corporate and the client perspective that when my staff walk into your hospital, see them as your patient that you have a duty of care for, rather than that HMO, the HMO people don't come again. We see facilities where the doctors that see, in as much as Liberty will attest, I tell my my staff, if you walk into a hospital, you can't walk and say, I want to see the consultant. I said, no. Just there must be a process that the hospital has outlined. You are required to follow that process. You can't just walk in and say, no, it's a consultant I must see. And therefore, if I don't see a consultant, it means that the hospital is bad or that the HMO is failing. No. You follow through the process, and you will be referred to see a consultant because he is a consultant. He is a consultant. It's not to see all patients that come into the hospital. If that is the process, follow it. But if that is being if that process, if they are taken through that process and they know that, look, at every step of the way, what is required for me to get good care will be offered, not because they're confident in our healthcare system and in the facility to use it. So please, we are your patients. We are not HMO patients. The only vehicle we are able on a long term, as Toyin would, because that's always a big discussion when it comes to renewal terms. We are not oblivious of the fact of the changes, the economic situation, and how that is impacted. And we would continue to engage to make sure that the right premium is paid for the right plans and the right access. And I know that the HMOs, the health insurance, will also continue to engage with you, the health providers, in a sustainable way. Please, when you are sending in your tariff, make it be a tariff that is sustainable in the long run. Because it's a premium they are collecting. That premium is going to a pool. And the pool must be managed in a sustainable way to ensure that in a 12 calendar month, access to care is available to their enrollees, and you, the healthcare provider, is paid. Please, if for any reason you feel the HMOs have not met up to your expectation, it is not friendly to wake up and shut your doors to your patients, because there are issues concerning either a backlog of payment or claims that have not been resolved. I believe that should be a continuing engagement and discussions, but access to your patients should not be discontinued overnight. That, for us, is a breach of contractual arrangement. I'm sure in your contract there are windows for discussions, resolutions before a termination or a cessation or a suspension of access can be instituted. Please, let's keep to those contracts and let's make this work together. Thank you very much.
Thank you very much, Dr. Jato, for that very insightful presentation. Please, let's put our hands together for him. Yes, so for those that came in later, in your files, there are 2 papers there, and the other one is for your feedback. Please do not forget to put your feedback in that paper. And then for those that came in, as I said, there are some papers, little papers that was supposed to be given to you at the provider at the registration desk. And so if you haven't gotten yours, please do it for the raffle draw. So the next line is the fastest fingers. We want to see how fast your fingers are. Please put it up. They can't see. Please, I don't know if you can see this screen. Can you please help tilt this screen? Okay. Can you see it now? Let me call it out. Airtel 5500352512592576. Of course, I'm not going to call it slowly. Glow 388-66-141-3402821. MTN 9392-2020-0578-3588. And lastly, 2508-00192-39275. Apparently, we have 2 MTNs here because I think the majority uses MTN. Or is it the same thing? Okay, no. 9368-5521-7100-82326. I can hear some cheering at the back, which means if you were able to get any of it, can you just signify by raising your hands? Oh, wow. Please, let's give him a round of applause. Was it the only one? We have like five. Oh, lovely, lovely. I think it's because they are sitting in front. So that's why it's good for you to come early. What network? 9 Mobile, Airtel, MTN, Glow. No one uses Glow here. Oh, lovely. And Airtel. Okay. Oh, lovely. Okay, the next thing on the agenda, I want us to make a warm welcome to the head of medicals for a short address, Dr. Eyitayo Abejide.
Thank you, everyone, for being a very, very attentive audience. Riding on the back of Dr. Arobodade and Dr. Jato, I think for the first time in a long time, there's a situation in which we all can clearly say that we're all in this together. In those days when you are talking to a rich man, you say, how far now? You say, Omoko easy. It's a lie. But in this situation, we're all in it together. Now, it costs you 3 times as much to fill your tank. The dollar is not coming down. Now, the bank tells you to bid before you even see the dollar. You know, so it's really bad. And for almost all of us, the only thing we know to do for a living is this business of healthcare. So thank you very much for coming. And it's really nice to be here. You know, there's no COVID, we're not wearing masks. We can use our lipsticks, you know. It's really nice. It's a lot different than, and we all lived through the pandemic. I know many people lost people. I lost a few people myself, you know, but we're here, we're alive. It's fantastic. And so we are getting on with the business of living. And like Dr. Arobodade said, it's not malaria and typhoid anymore. There are very few of us who don't have a relative or know someone with cancer. Now we're treating bigger diseases that don't seem to go away. We're dealing with fake drugs. We're dealing with patients who want only branded medications. And those branded medications are fast disappearing from the shelves. I remember one fantastic drug they call Twinstar, an antihypertensive. It just disappeared. Now we're dealing with Seritide from I don't know what to 60,000. I mean, we're dealing with unbelievable hikes in drug prices, you know. And so it's imperative that we listen very well. We have a rich panel of discussants, you know, to guide us through this. Because CMOs and providers have to keep making money. And so we need to learn how to stay profitable in this hyper-dynamic economy. And you know, the interesting thing is we don't even know what is coming. So we need to, I think it's early days. The fuel price went up in May, I think. So it's still early days. It might go higher still. We might still be, maybe pay 1,000 for fuel. So I'm glad we're all here to listen to discussions as to how to make it work. And so all of us, HMOs and providers, find how to stay profitable. So thank you everyone for coming. Thank you. We're making very good time. Like Timileyin said, we started on time. We won't keep you longer than necessary, so you don't get stuck in traffic and burn more fuel. Thank you everyone. So.
Let's put our hands together once more. That was very direct, very relatable as well. And I'm sure everyone knows where the shoe pinches. All right, we also just want to quickly acknowledge that there are people online that also want some of the recharge cards that were displayed. So nobody is left out. Everybody has come to the table and we're all feasting together. Just before we get into the next segment that we will be flowing into, we want to give everyone an opportunity to ask Dr. Arobodade a question or two. Because we know that it's possible that during his presentation, there were questions in our minds that we possibly want to ask. So we want to give that opportunity to everyone. Do we have anyone who perhaps has one question? Okay, I already see one hand going up. I want to quickly count so that I'm able to take them. That's one. We just want to take 2, 3 questions if possible. So we have 1, 2, and 3. All right? 4. I will just stop there for time's sake. So we have 4 questions. That's 1, 2, 3, and 4. Sorry, sir. Would you like to take him all together? Okay. All right. So let's start with the first person. Yes.
Good day, everyone. My name is Odoji Ejo. Well, I just want to ship in
Sorry, sir. What facilities? Just so that we can tie it all together.
from SO Hospital. SO Hospital. Well, I just want to ship in a kind of suggestion based on one the last presenter just presented from Stanbic IBTC. Now, he made mention of patients, partnership between the hospital, the HMO, and also the patients. Now, there's this word that has been striving, that he keeps saying, or everybody keeps saying. Now, when the patient gets to the hospital, they say, HMO patient don't come again. Now, I want to make this suggestion. The HMO should find out time to go to these enrollees, wherever they are, maybe in their companies or in their organizations, to go and educate them on the way to behave in an hospital. Now, I want to say this because patients come to the hospital with the orientation that they remove my money from my salary. Therefore, I must go there every month. They go as far as to tell the doctor what to treat them off. I'm telling you this. We are talking to some of the patients, they are browsing their phones. They will say, what did you talk last time, Seth? What did you say? You can imagine such sort of thing. Then again, you, the HMO, need to understand that the doctors, the nurses, the medical personnel also have what we call mental health they must take care of. You see an aggressive patient come to the hospital aggressively at the entrance of the hospital, attacking nurses, attacking doctors. You see, these things, they go to human beings. These doctors are also human beings. The nurses are human beings. So please, you need to do a lot of work on the patients. Let me say this, sir. To the point that I have typed a special letter I start giving to some of the HMO patients. I do as far as that level. Because one, we have to manage the doctors, we have to manage the nurses, so that they can have a balanced health. Thank you very much.
Thank you very much, sir. So we'll just take the 3 others. So that's number 2, number 3, and then number 4.
Good morning, everyone. Okay. Sir, you talked about...
Sorry, your name and the facility you represent.
Sorry. Shekoni Jimaima. Okay. I'm Shekoni Jimaima and I'm representing G&J Calvary here in our speech center. Sir, you talked about telemedicine and I would love you to shed more light to that. And looking at the current healthcare palaver that we are facing right now, what can you say about the feasibility of telemedicine in Nigeria? Thank you very much.
All right, thank you so much. So just 2 more. I think number 3 is here. The 3rd person is somewhere here.
My name is Tunde. I'm Tunde Olaomi. I represent Premier High Center. Okay. Sir, we appreciate the presentation you made this morning. You stressed so much on the quality of care, but I want to believe that our expectation of delivery of service is also induced by what we get. It is by what we get that we are able to provide what we are also providing. I recall you also mentioned you had served at some level of government interventions. But I want to look at the sector where we all operate, which is more of a private sector. The reality as of today is that there's a lot of pressure from the service providers platform. The reality of the moment puts more on our side than on the side of the HMO. As we speak today, I will expect that we have a symbiotic relationship and discourse that will provide a much more friendly relationship on the platform, because we are the interface between the client of the HMO and the client itself. The HMO don't have direct interface with the enrollees. It is the provider. We are the picture of whom you are to your clients. So you need to make us happy. And with the economic realities as of today, I love the analysis you made as Padizo. We all know the realities of the moment. And we understand the point of the fact that the health insurance group operates on premium basis, which is annual. Am I right? So if this is the case, where we are today, how do we get out of this doldrum? We cannot continue to say, let the providers tolerate, understand. Tolerate and understand. Zalatan, for those who are in the healthcare sector, used to sell for 4,000 something. As of today, it's about 10,000. You have paid the premium. I'm sorry, you have collected the premium. You expect us to still continue. How do we cope with this level of service? Let's face the reality of today. Don't let us just postulate on what it should be. How do we move from here today so that we all live here happier than we came in? Thank you very much.
Thank you so much, sir. So I think we have just one more question at the back. The fourth person raised the hand at the back.
Okay, so
good morning, everyone. Okay, thank you, Dr. Jato, for that presentation, and thank you, THT, for this forum. I've been looking forward to an opportunity like this. So, I have a suggestion, and then, okay, I've said both of them as suggestion. I happen to be an enrollee for...
Sorry, could you provide us with your name and the
Oh, sir, so sorry, sir. My name is Oluwatoyin Benson. I work with Global Medicare. Okay, so my question and my suggestion is, I happen to be an enrollee, and also in Global, I happen to be the person that manages THT. So as an enrollee, I have experienced some kind of not too nice service from THT, and I would suggest that for we to cut short our enrollee having issues, we should look at the way we communicate. Now, you are sick, you have an emergency, and you have to wait for so long for THT to get back to the hospital. In terms of, you send a mail and you are waiting, and your child is almost dying. I remember when I was going to give birth, I had to beg and ask them to send the authorization early, so that I don't wait. I've experienced this several times. So I can imagine what an enrollee will feel when they come to our facility and they are shouting and saying, "Madam, please attend to us." Honestly, our hands are tied. We want to see your enrollee as our patient. Me, I will speak for myself. I'm very empathic, and I always give the best to my patients when they come in. But my hands are tied. What can I do when the patient will have to wait for so long? So I would like you to look into that aspect. Other ways and channels of communication that are very prompt and fast, because we are in the healthcare space and most times we have emergency. That is one. The other one is, for we to see this enrollee as our patient, it's in your hand. When I have challenges, when I have issues, how are you looking at it from my end? As a vendor, I want to service your enrollee. Sometimes when I want to go to hospital, I'm always like, let me just pay. Because there's this stigma that they give to HMO people. I don't know if you guys know it. Like, if it's a cash paying, they are giving you one professional treatment, but if you're HMO, you're really feeling discomfort. But I know THT, you're a standard and a very good HMO. We can do better. Honestly, I want to plead and implore that God will continue to strengthen you guys. Please, let's look at that way. Treat us well, and we will treat them as our patients. When we have issues, nip it in the bud. Be in our face. Feel what we are feeling. And honestly, we will treat this enrollee, because I am an enrollee and I'm also the one taking care of you as a vendor in my facility. Thank you very much.
Thank you very much. I believe that was a comment for THT. And I know that it's a feedback that has been well noted. Thank you once again. Now, the last two before that were questions and they were directed at me. So I will start by answering the last one. That's the one before the madam that just spoke. It says, talking about quality, what do the providers get? Okay, so I'd like to start at that by saying that I actually don't work for THT. I am a provider myself. I actually run a medical facility in this city. At the beginning of this year, I had drawn my budget for the services I was going to provide. And unfortunately for me, I am unable to adjust that budget, which means that I have to live with the reality of the current situations. So I know perhaps your perception was that I was speaking on from the perspective of being an insurer. I am not. And everything that I said with passion from my perspective as a provider. I have to also deal with patients that feel that their insurance should cover so much. And I know that what they are paid for also just goes so much. I also have to deal with the fact that medications cost in January are also not the same medication cost in August, in September, or in October. I have to also deal with the frustrations that the patients feel, that it seems as if some promises have been broken somewhere along the line. But the reality is that whether you're a provider or you're an insurer, we're all in the same boat. And until we realize that and begin to find collaborative ways to address the issues that concern us, we will not move forward. If you think, oh, it's because they are insurers, they have taken all the money. You must also remember that the insurers too deal with dollar just as you deal with dollar. And dollar affects everything. Even what the market woman is selling okra, dollar affects it, the market. So when I say we have to collectively look at preferring solutions, I mean we have to collectively look at whether we are providers or insurers. We have to look at ways to make this more efficient. Somebody talked about, when we were talking about quality, we talked about timely. And we just heard about delays in getting approvals for care. I'm aware that in this city there are people, and in fact, there's someone amongst us that I know was working on this problem, on the real-time approvals for care provision that are insured. So the things that I'm saying is that we need to collaborate more. And I'm glad to say that this is one of that kind of way we can figure out things. So we have feedback, THT has feedbacks, providers also see perspectives on things that are happening. But we must stop thinking that the problem is somewhere else. Somebody said, she said here earlier on that whether you're a rich man or you're the average citizen, we are all feeling the pinch. And that's why we all must try to see how we can collectively address this situation. So the other question was about telemedicine. Somebody asked me to expatiate. If I was to expatiate, I would gladly do because it's my field. I will take the next 3 hours. But I'll go so far to say that telemedicine is using digital solutions to remotely address provide health care from a distance. So if I'm here, in fact, the truth is that telemedicine is not new. It's the buzzword that appears to be new. Many of us, if you're a provider, you have had a father, a friend, a family member call you once and say, I have a headache, I don't know what to do. And you just suggested something. You provided telemedicine care. It's just that today now technology has come to the point where we can now direct who it is. We can say, the dermatologist, like the example I gave, so look at the skin lesion I have. And then use things as simple as Zoom. Also, other technology that has been made available. I say, I can zoom into my hand, look at what I have, and then you can profile what solution is possible. So there's a whole spectrum of it, from simple SMS to solutions. I was in Luxembourg some years back, and I saw a very impressive solution. They say if you're an elderly woman, they have a lot of elderly population. Many of them live alone. It's beginning to happen in Nigeria now. All our children are going abroad. By the time we grow up in a few years' time, there'll be nobody with us. We'll be living alone. So they live alone in their houses. And then mama can fall down and break her femur, break her pelvis, stay on the floor there, unable to get to the phone, unable to stand up, and then die on the floor. People have been found dead in their homes, elderly people. They died for 2 weeks. It's just somebody said, this mama used to come and collect milk here. I've not seen her for 2 weeks. And then they called the police and they checked the house. Found mama is dead somewhere there. So they had this solution that was very interesting. You wear it around your wrist, you wear it like a necklace. And then what it does is this, it calculates if you were to fall, if the person was to fall, the device will determine whether you actually fell or you were sitting on a chair or you were lying on your bed. So it will calculate it by the acceleration of the fall, by your impact on the fall, on the floor, by the angulation that whatever changes happen, it calculates and determines if you had a fall. And if it decides that you had a fall, it will call 911 remotely by itself. And then it will tell you, stay where you are, don't move. And then the ambulance time in Luxembourg then was 3 to 5 minutes. So it means in 3 to 5 minutes, if you fall, just stay there. Somebody's going to open your door and then come and get you. And then before they come, you'll be hearing conversations that can support what you do. So those are the beauties of technology. That's one extreme end. If you wait for Lasambos to come and pick you in Lagos, they will come. But it will be 5 minutes. They will come. If you call Lasambos, they will come. But it may not be in 5 minutes because of traffic. And then, so those are issues that technology can breach. We had women in labor stuck in traffic, and they put a call to a doctor and it was guiding them on what to do. All of those are in the realm of telemedicine. So, and I'm so glad because I've seen a few faces here. We have some experts in the room. We have people that are implementing solutions that address all the issues that I'm talking about. Some of them are in this room, and we will do well to start leveraging on what they have. Thank you very much.
Let's put hands together once more. Thank you so much, sir, for addressing all of the concerns raised. All right. Thank you so much. We believe that there are some other questions also coming in virtually. We're going to be addressing all those questions as well as quickly as we possibly can. But because of the brevity of time that we want to ensure that we're able to spend together and maximize the impact of our engagements today, we would like to proceed very quickly to the panel discussion that we're going to be having. If I can get some support with moving the podium up, that's going to be great. Just so that I can very quickly introduce the panelists that we would be having. Is it possible to get some support? All right, I think that whilst we do that, we can quickly have the fastest fingers once more. Is that okay? Did I hear someone say? Okay. All right. If the multimedia team will be kind enough, kindly put up the next set of. They say I should leave the road. Let me even move to my seat, so I'm not blocking anybody. So the numbers are up. It's a serious something. For those that cannot see clearly, Airtel is 5719867236317493. For the Glow line is 38869913942627. For the first MTN line is 5376566668416235. For the 9 mobile line, it is 0513476293208004. For the last MTN, line is 4202-7321-8269-6 71721. Do we have winners already? Sincere winners. Has anyone successfully loaded any of them, or do you need me to call them out? Anybody? Should I call it again? There's no need. Somebody said they've loaded everything. Can the loaders kindly signify? Nobody. Everything cannot be online. Oh, but let's check. Anybody online? So Airtel, anybody? Thank you for your honesty. Let's put that together. What line? Airtel. All right. Anybody with a glow in the room? At the back. Fantastic. Thank you so much for indicating. Our loaders are finally showing up. Anyone for MTN? Let's just be sure that all the cards have been loaded before we move ahead. Anybody? Anybody for the first or the second MTN? Any MTNs? Any MTNs? 9 Mobile. 9 Mobile. As the glow indicated, has someone indicated for glow? Okay. All right, so we're going to track the online space and be sure that we're able to identify very quickly everyone. All right, so sorry. Thank you so much for helping to move this, but can I get assistance to move it this way so that I don't obstruct any of the panelists? Preferably that way. Yes, I think it's nice. All right. Thank you so much. Can we still see me? I'm not sure everybody can. But we're going to have to manage and make do with what we have. Have we found the other loaders? So I have relocated. All right. Not the one that you're thinking. All right. So we're going to be having a very quick fire chat with everyone across the hall, and we would also have panelists joining us upstage to stir some of these conversations that we have started having already. All right, so I'm going to be introducing a number of people that will be joining us for this very quick conversations. For the purpose of time, I'm just going to jump right into it. First of all, I would like us to make welcome upstage Mrs. Rita Chukwu. She's the Deputy Director and State Coordinator of Yaba State Office of National Health Insurance Authority. Please let's make welcome Mrs. Rita Chukwu as she joins me upstage. Let's put this hands together. You're welcome. Also join me upstage is the medical doctor and medical director of Healing Stripes Hospital. Please let's make welcome Dr. Ifeanyi Godwin. All right. The next panelist that we're going to be having upstage for this particular conversation is none other than the Chief Medical Director and CEO of Esso Hospital Maya in Ikorodu, Lagos State. Please let's make welcome Dr. Odoji Augusta. Thank you so much. You're welcome. And the last but not the least to join us for this panelist conversation is none other than the Head Strategy and Commercial Services at Mikio Healthcare, the MD/CEO, Dr. Adekunle Megbuawon. I hope I pronounced it properly. I gave it my very best. Let's put hands together, please. All right, so we have a loaded team up here, and we are about to have a very, very robust conversation, and we're quite certain that it will be a productive one as we're able to tap into the limitless potentials that they have in terms of expertise and experience. Thank you so much for making out the time to be a part of today's conversation. All right. Thank you so much. So in getting us started, I believe it's in keeping to take a first word from everyone, just the same way we're going to close with a last word, as it were. The conversation largely that has started throughout the course of today's Providers Forum has been centered around ensuring that we're able to access quality healthcare, particularly in the hyper-dynamic society that we have. Things constantly, rapidly changing and evolving from day to day. You sleep today and then the moment you wake up, things have completely been altered just by the very mention of the volatility of the society that we're in today. And so I believe it will be in keeping to take first words from us. In 60 seconds, you can share with us your initial thoughts. I'll start with Dr. Adekunle to just give us his own initial thoughts about the entirety of the conversation that we've already started having today.
Thank you very much. Thank you for having me here. My name is Dr. Kunle Megbuawon. I'm the head of strategy for Mikio Healthcare Limited. And Mikio happens to be one of the foremost diagnostic centers in Nigeria. Right now, we are the only healthcare provider that has a pet city in the whole of West Africa. Why Dr. Abejide was talking, he said we are no longer treating malaria. Now we are dealing with cancer. Cancer is now a disease of public health importance, public health emergency. And we are seeing people coming down with cancer. And we felt that if the federal government could not address this, we decided to take the bull by the horn, and we set up the only and first pet city in the whole of West Africa. So anybody that has cancer now, one of the things we are doing, we are talking to HMOs to say, look, you can't exclude cancer treatment. It has to be included, because who knows who's going to be the next person. So we are dealing with that. So in terms of quality, quality is a continuum. Quality never stops. You have to look at your customer. You must look at from customer dissatisfaction to customer satisfaction. You must go beyond satisfying your customer to delighting your customers. Go beyond delighting them to your customers being obsessed by your services. And when you are now at the peak, you're now wowed by your customers. Now, I'll give you an example of what we did at Mikio. People go to hospitals and they say, oh, these are HMO clients. Do you know what we did? We decided to turn the reverse way. When people come to Mikio, those that are making payment, they go to the general reception. We created a new reception for HMO patients. So anybody that comes to Mikio, you're an HMO patient, we give you a VIP care. You have your own phlebotomies, you have your own where your blood is taken, your sonographer. After the entire experience, we now give you a spa care. You go in, you go and have a spa session while you are waiting for your result. This is in terms of quality. No, if you have been to Mikio, you will know that it's true. You go in, you have a, so by the time your result is coming out and you are getting your results, you're already satisfied. What are we saying? We are saying that quality is first what the patient decide it is. First, quality is in terms of what we can see, your ambience, how beautiful your environment is. Second, in terms of the way you care for that client, the way you care for that patient. And my advice to hospitals is this: look, the times are changing. The big hospitals may start coming down, because in newer hospitals, you know what they are doing? They are going after the patients. And with health insurance being compulsory, patients are going to choose where they want to get to. So you're going to give the same malaria drug. You're going to give the same antihypertensive, but it is the quality of care, the way you service your customer that will differentiate. And customers are gradually going to gravitate to where they feel they are appreciated. Thank you.
Awesome, awesome. Thank you so much. Let's put our hands together. I particularly like the fact that you cascaded it from customer dissatisfaction to customer satisfaction to the customer's delight to being obsessed. Imagine someone just wanting to go to the hospital, you know, and it's a very, very good way to look at it. Thank you so much for, you know, presenting that very succinctly. Thank you so much. So I'm just going to move very quickly to Dr. Odoji. Is that okay? All right. And what I would love for you to do, if you can, is to just very quickly speak to the fact that when we look at the healthcare landscape in Nigeria, we know that things are changing and things are evolving, but how exactly do you think we've fared in terms of being able to match that evolution thus far?
Thank you very much. Nigeria is rotating very, very hyper-dynamically. And kudos to the healthcare practitioners, the doctors, and the nurses. In the face of the events happening now in Nigeria, a lot of doctors are able to stand up to face the challenges that are facing Nigeria now. I give you an example. This year, I happened to be someone who experienced both experiences, the bitter one and the burst one. My father was amputated this year. A Shell retiree, he had a very bad treatment with a particular HMO and a facility, and we had to move him to another facility where he got the best care, and kudos to those HMO and facility. So you see, it's a hyper-dynamic situation. Some people will say they are HMO patients, like we've always said, but some other persons are giving value-added services. And I think that's the area that many of us that are health practitioners should look into. You have to be able to give value-added services to whatever care that you are giving to a patient. You put yourself first in the shoes of that patient. How will you feel as a patient that you are being attended to in that way? Will it make you feel good? I didn't feel really good when I saw my father being mismanaged to the point that a 79-year-old man who worked in Shell for 35 years, and we see his position, having him amputated. But I also felt very good with the other HMO and facility where they did good to my father and he's back on his feet. I felt very good. So kudos to doctors and healthcare practitioners, nurses, lab scientists, physiotherapists, radiographers, radiologists, counselors, or what have you, that do an excellent work. The times are changing. Have professionals just like you that they will relate to, that will ask questions. Just like I was related back to by my father, and I had to ask questions. So if they have people they can ask questions and they can give them the true situation on ground that you are shading, then you're going to get yourself into some troubles. But those of us and those of us who are doing excellently well, thank you very much, because we're able to stand and face the hyper-dynamic situation in Nigeria. Thank you.
Fantastic. Thank you so much. Thank you so much. I was quite delighted that you emphasized the need for us to go the extra mile, the need to actually not just render what you would call typically what the services are, but to actually add some significant value to that. So thank you so much. I believe that was very well said. Let me just quickly come over to you, Dr. Ifeanyi. And what I really want us to begin to delve into at this point is that we can't even begin to talk about quality healthcare if there is limited access. Because whether we like it or not, the reality of the times that we're in is that a significant proportion of individuals have not even gotten the access to start with. And so what I would love for you to shed light on as quickly as you possibly can would be, in your own opinion, what initiatives would you consider that would help to improve access to healthcare?
Thank you very much. Let me start with the background. We talked about underfunding of the health sector. But we have a problem. If the health sector is underfunded, you do not expect the quality care you have in America and other areas. Two, we have a problem in measuring our quality in this country. As a public health consultant, I have come across quality measures in different countries, but Nigeria has no framework for quality auditing. What we do is that we jump to JNCI. JNCI is coming to us. JNCI is using the American quality framework. So you find out that even the fees have been involved in HMO for almost 2 decades. My patients are more HMO than private patients. Private out-of-pocket is catastrophic spending. So we don't have adequate funding, and we have 5% of people who have really access to health care. So I expect the government in their operational guideline of NHIA, where they have put in the missing link of mandatory insurance, to put up some policies that will make it difficult for people to do any other thing with the government or business without having a health insurance. If there's market, you cannot enroll your children in school, you cannot do anything unless you show us, just like NIN, just like BVN. We thought it would not work. Go and open an account now without BVN. It's not possible. So we must come out with something like that, where the government, because the political will must be there. If the government is ready to go, we have the population, we have the number, that if it is not compulsory, you will now realize that we don't have enough doctors, we don't have enough nurses, we don't have enough pharmacists, all the medical, practitioners in different aspects. We don't have enough. If that happens, and we have half of the country enrolled, you will now find out that you don't have enough HMOs, we don't have enough workers in the HMO. In fact, to have this kind of meeting, you need now to go and rent a very big hall, because people will come in and you may in fact say, don't come, let's do virtual, because there's no space to accommodate them. So the government also has to finish what they've started. I'm happy the NHIA person is here. Finish what we started in churning out operational guideline. Let there be something that we make it compulsory by tying it to something. You go to the bank, you cannot open an account without insurance. Don't enroll your school. These are the things that has to be put in place to be able to enroll quite a number of people. And when we have that number, then we know we are practicing insurance. What we are practicing now is mini insurance in Nigeria, because health is social good. These people here are angry, and they provide also, because when they look at what comes in and what they are spending, if they do proper analysis, they find out that they're not doing well. So they're angry, about, but like the former speaker said, please, we used HMO to build up the hospital in the last 10 years. And, you know, we had a lot of things we did with the HMO fund. It was steady. It was
political zone. So each geopolitical zone has a teaching hospital that you can access care as a cancer patient, and then FCT as well. So NHIA, we are not sleeping. Every day we are trying to make sure that something is done to ensure that people who are enrolled with us or who are enrolled under the HMOs have quality healthcare service. I think I'll stop here so that other questions can be taken care of.
Thank you so much. Thank you so much. And I see that we made absolutely no mistakes in putting together this panel. Every single point has been touched on just in getting started with the conversation already. But please allow me to come back to Dr. Augusta, if that's okay by you. All right. So what I would like for you to shed light on, if you do not mind, would be to speak to the fact that we have talked about it earlier. That one of the elements that makes quality what it should be is that it should be patient-centered care. In that sense, what exactly would you consider some of the challenges that hospitals or providers might be facing in terms of being able to deliver on that patient-centeredness, as it were? And maybe how to address some of those challenges that they might be dealing with as well.
Thank you very much. I always like to speak as a CMD who brings out money from the pockets of the facility she manages, and I also look at the picture also as a patient. When I do that, I think I'm able to balance the question. Now, as an hospital, a CMD, what are the challenges I face? Of course, money. Money answers all things. Money. I need to get more money. I need to get drugs, quality drugs. I need to get experienced staff that are willing to work, that will have the right attitude to patients, that will be there to give, like I always said, value-added services, not just giving that care, but also giving value-added services. So money is a challenge. Getting adequate and standard drugs is a challenge. Recently, we all know what happened with GSK in Nigeria. So I had to get Augmentin for 25,000, 1 gram for a pack, and I needed 2 packs. So that's 50,000 for a patient, and I don't know how much THT will give me to pay for. So you see what I'm talking about, and I need to give quality care to this patient. So money, everything is just centered on money. My facility runs on solar. The environment I stay hardly gets light, and that's because all thanks to my husband, who is a solar engineer expert. For him, I would have also been talking about diesel and fuels. Of course, I had to get 15,000 naira fuel yesterday into my tank, and I checked the gauge. I shook my head. So it's still money. Solar is not cheap. If I were to go to the market and get these things myself and get an engineer, I know how much I'll be spending. That's running about like 7, 8, 9, 10 millions. Where do I have that kind of money from? Then, of course, the Japa syndrome, doctors, nurses, they are running. In fact, when Dr. Arogutade was talking about employing nurses, or radiographers that came, some came, and nobody finally resumed. It happened to me last week. I had to get more registered nurses. She actually came, and the next thing she told me the next day that she's jackparing. I was like, wow. So it's affecting everywhere. Then we talk about security. Security is very, very important. It's a big challenge. My facility is busy. In the night, you knocks, emergencies on the gate, and I've been a patient multiple times myself, and so I always have this kind of empathy. Knock on the gate, security opens the gate, and then the next thing was a gun. somebody pointed a gun to come rob in the facility. So we needed security. Call the police. Oh, what facility is calling? Where is your location? I had to call somebody else of authority in the police before attention could be given to me. What if I don't get that I didn't have that kind of person? So that means all of us there would have, I don't know. So then another thing is pay. So if you pay me well as an HMO, then I'll be able to pay my workers well. The man sent me an SMS yesterday and said, we are a family. And I looked deeply into that word. Why did this man send me a message that we are a family? I think he's satisfied. That's why he sent me that kind of message. So we will all continue to put in our best and hold meetings like this, which is very, very important, to air more views, speak our minds, see challenges that are there, and then see how we can combat them and move on. Because patients will always be there. People will always be sick. I can become sick tomorrow, and I'll become a patient. How will you treat me if I get into your facility? Because I can't treat myself. So once we have this understanding, then we get the balls rolling and everybody will be fine. Thank you very much.
Fantastic. Thank you so much. Thank you so much, Dr. Augusta. Very well said. Very, very well said. So I'm going to, do not mind. One of the reasons why I'm coming back to you is that Dr. Augusta hit it right there about the need to be able to establish customer satisfaction. And this is something that you also spoke to earlier, cascading it. But I would like to ask, in your own opinion, how best can we really measure this? So we know that, yes, we want to move from, like you delightfully put it earlier, from customer dissatisfaction to delight to obsession to wowing the customer. But what measures could we possibly put in place that would help us to objectively, we get to measure this as much as we possibly can? And you can also chip in something about technology also, if that's something that has been helpful.
It's science. Healing is an art. Healthcare is business. Medicine is science. Healing is an art. That's where customer satisfaction comes in. But healthcare is business. I will focus on the healing being an art. In med school, we're taught showmanship. You want to take the BP of a patient. You do all the showmanship. You are still taking the BP. So the healing being an art. Two people have malaria. You have done your medical diagnosis, and then you discovered, okay, I can give artemether, lumefantrine, scanty MP. But you also know that that may not totally heal this patient. The healing aspect now comes to the way this patient is cared for. Somebody that is in a shabby hospital, the walls are dirty, everywhere is looking anyhow, yet is a PhD holder, is a consultant, all the degrees. Someone else in a very neat environment, maybe an old building that was painted and then turned around and is looking so beautiful. You discover that that person in that beautiful environment will feel healed first before that other person in a shabby environment. Now, in terms of quality customer satisfaction, if we are to go to the educational aspect, we may not have all the metrics, but you must develop your own metrics of how to measure how satisfied are your customers. Quality is how the customer define it to be. The way my nurses present themselves is regarded as quality to someone, and to some other person is not. Now, I take an example of military officers. Someone in the army, if you want to salute, you salute this way. Someone in the navy will salute this way. What are they doing? They are saluting. However, there's a standard. There's a standard in the army that you must salute this way. The question is, do you have a standard in your facility? Do you have an SOP, standard operating process? Gone are the days where we just operate anyhow, where we just set up an hospital, you bring in an employee, he's coming with his own experience,
And then another one comes, it comes with no experience, there's no culture. Now, you must define what your standard is going to be like. If you're going to admit a patient, what is your standard of admitting? What are the baseline investigations that must be done? How will your nurses prepare the bed? When a client walks into your hospital, how does your security greet the patient? Your front desk, how are they dressed? Do they just appear shabbily? How do they address the patient? How does your nurses greet the patient? Now, we think that these are very difficult things, but very simple. Just put it down. This is our SOP. My security officer, when a patient is coming in, the first thing you will greet, good morning, welcome to First Bank, welcome to Orange Health, welcome to Macure. You have defined how your security is going to do that. Now we discovered that when you train your people, when you have a standard, it has been written out, you give it to them, give it to the security man. This is your standard of operating. If a patient comes, you greet. Sit down with them. Let them read. Discuss it. When they act it out, let them make mistake. You come back. Before you know it, it becomes a culture. That is what your quality is. Now, because you have defined what your standard is, what your quality is, you can begin to improve on that standard. You get your feedback. Simple survey. Let your patient give you feedback. Are you in contact with your customers? In my center, everybody that comes, you must receive SMS from us 24 hours after. You must receive a call 7 days after. You must receive a call 30 days after. You must receive a call 90 days after. Why? You want to be on the face of the patient. That's our standard. You discover that because a nurse is calling a patient after a patient was admitted, and by the next day the nurse calls you, hello Mr. Kunle, how are you? How are you feeling now? Oh, the patient will feel so happy. Because why? There are so many things already bottled in his mind that he will tell the nurse immediately. That is the feedback you are getting. It will help you to improve. By the time you are calling 7 days after, you are calling to look at how are you feeling now. The patient is feeling better, or he wasn't satisfied with the way somebody spoke to him, he's going to give you that feedback. So you measure your quality by the feedback that your clients are giving you. Now, the key to success is you must have strategy. You must develop strategy. You don't just go into healthcare and think that things are going to work. I tell people Nigeria is a population of how many millions? People are sick. People are sick. If you take your local government alone, the number of people in your local government, these are potential sick people. Now you are not talking about disease care. You are talking about health care. So you want to prevent them from falling sick. So you are doing preventive health for them. And that's part of what hospitals must begin to look at. Not just disease care. Gone are the days where we wait and allow people to just walk into the hospital. Now we go to them. Because those are part of your target market. So your strategy, your process, you must have a process, your standard operating process. You must develop process in everything. It's a continuum. When you finish with that of the nurses, go to that of your customer service. Your doctors must have SOP. You don't just come and treat anyhow. You must keep discussing. Keep discussing. When you see a patient, you must discuss it. Your admin, your laundry. Before you know it, every aspect of your business has a standard. And then your culture. How do you want your people to behave? You must have a behavior. Now, one of the things we've learned, which I learned as a public health person, is that disease is not just clinical diagnosis. You have what we call the clinical diagnosis. You have the behavioral diagnosis. There's a behavior that is causing the sickness. There are predisposing factors. There are enabling factors. There are reinforcing factors that are also causing the disease. So you must identify those ones, and then you must create intervention. What we have been taught is creating intervention in terms of clinical intervention. Beyond that, there's behavioral intervention. Then your educational intervention. What strategy do you want to use to address this? Thank you.
Thank you so much, Dr. Kunle. That was very, very well said. I think that you even answered a few other questions that I already had penned down as well. I think it's working. All right, thank you so much. One of the things that Dr. Kunle said, which I'm sure that will resonate at the end of today, would be that medicine is a science, healing is, and healthcare is. Thank you very much for echoing that. It just goes to show that we're paying very good attention. We would also like to take questions from the audience. You wouldn't believe that we've already spent 30 minutes in this conversation, but yet it has been so loaded. All right, but let's see if we can take questions from the audience. Do we have anyone who might have a question directed at any of our panelists at this particular point in time? You can write them down, and then we will pick them up, and you can be rest assured that those questions would be attended to. Let me just quickly come over to Dr. Godwin. One of the things that has been said, and this has echoed as well throughout the course of today's conversation, is the fact that at the end of the day, I would like to say all lives matter, or better still, all patients matter. So we've heard that appellation repeatedly about HMO patients, not HMO patients, how they should be treated, and things of that nature. We've also heard Dr. Augusta mention how that the financing of all of this is very, very important. So what we're doing in terms of healthcare financing plays a significant role in this conversation. So I would like to ask, if you can quickly comment on this, how can we really ensure financial sustainability while delivering quality healthcare? How can we ensure that the finances are able to cater to the quality that we really want to see?
Thank you very much. I'm so keen on financing. I think the problem we have holistically is that we've not come to terms the cost of healthcare in this country. If I trace it back to the NHI's days, an actuarist was flown from the US who came and they didn't have any data, and he just fixed the 500 naira capitation. And so after 1 year, call me back. By that time, you have seen patients, no matter the number, I will now come and put in the data I've collected, and then give you the actual capitation that should drive the health insurance. That man is still waiting for that call to today. So we are just not ready to finance healthcare. NHIA bill has been signed into law. Good. But you see, the implementation is where the problem is. LASRA is doing their own. LASRA is doing their own. And we find out that a lot of hospitals did not even register with LASRA because of the capitation, the fees. Now, we must look at how to cost healthcare before we talk about quality. Everybody wants a qualitative health service. I agree, because you can be a patient tomorrow. But are we going to back it up with adequate financing? In a country where people are abandoning their private practice and japa, then there's a problem. They're not breaking even. The health workers are poorly paid because you're not going to pay them from borrowed money. You pay them from the profits from the facility. Now, another problem we have in healthcare financing in this country is that we're mixing up two healthcare financing models. We are bringing in health insurance, and we are still practicing national health service. In anywhere I go, I tell them that I didn't understand it before. And so many people in this health sector do not understand there's a difference. The British started the national health service. You pay health tax, the government takes over, they build hospitals, they employ everybody to take that money and run it. Even if you are doing a private practice, they will also pay for the patients you are seeing in the surgeries. Now, they colonized us. They started building health centers, general hospitals, teaching hospitals, and we are financing with the budgets. Now, that system is still going on, and we have moved into health insurance. Now, if we say capitation is 200 naira per patient or 100 naira, the National Health Service running will just augment on what they have. But what of the private practitioners, private practices, facilities? They don't receive any subvention from the government. They have to run the place, even provide light and water. There are many local government areas in their place. You have to provide everything. My sister said she's on solar. For you to get a good solar now, you have to hold up to 25 million. To get a good solar, you carry your ACs. So that is where we are. Now, people are cutting corners. What my brother said here is true. You have to do things outside the practice. But I'm talking about the practice itself, the cost of rendering care in the private facilities. You can't give somebody in the general hospital 400 naira capitation and somebody outside 400, and you still pay the salaries of the workers. You still budget for them. It's not a level playing ground. You know what I suggested? Dissolve the NHS. Don't give general hospitals any subvention. Use it to register people. Give it to TH to register people. Give it to other HMOs. Don't give them any budget any longer. Take over the training. Let the Ministry of Health, Education, take over the training, and let the actual practice. We all go to the same market. We all, source our money. If you're a CMD of a government hospital, be rest assured you should be able to do the same thing I do in my place by being nice to patients. Let them come to me, and I will now make the money to run the place. So as long as we are doing this dichotomy, where the private people and the government, this is financed by government, not financed by government, and you give all the same amount of money to take care of them, we are going to still, have the same problem. In the next 5 years, you find out that we are still where we are. But until we go back to the drawing board, I know why I'm saying this, because thank God the NHIA person is here. Go back to the drawing board and look at this critically from public health financing strategy. You find out that you cannot mix the two. It's not going to work. Either we go to the National Health Service all through, or we go health insurance all through. Then what you are asking me about is that there are things you cannot do in a hospital if you don't have money. You see, when you do the analysis, for those who do analysis, but I'm sure that a lot of people here do not even know how to interpret ledgers, do not know how to monitor the separate units they have in the hospital, what they are making, and be able to take informed decisions. We may not be able to do that. And if we cannot do that in our facility, is it to the patient we are going to engage? Let us go home and engage our facilities. Let's talk about SOPs. Try and put down what you are doing in writing. Put down, how do you admit a patient? When a patient is admitted, what are the steps you take? Put it down and call it SOP. If I ask now, how many people sent birthday wishes to their patients this month? How many? Out of, you see that? Out of how many? How many people do call people they discharged back? Say, how are you feeling? How is, you know why I'm saying this? So that those who are not doing it can begin. Patient-centeredness is key. The patient is the king. It is no longer disease-centered, but patient-centered. Disease-centered is that woman had appendectomy. But now you are talking about appendectomy in the woman. So you look at the woman holistically. You know where it's coming from, the problems it's having. Somebody came from here to see me in VI, and he came to the clinic, and he said, look, do you know where I'm coming from? I'm coming from the mainland to see him in VI. So we have to give him discount. Yes, for taking that pains to come from mainland, leave all the hospitals in mainland to come to VI. So you have to be mindful of all these little things to be able to retain your patients. Retention of patients is the only thing that can make you grow. Retention of patients can make you grow. And if you're waiting to take loan from the banks are not ready to give you loans. And if you take loans of 2 digits in a hospital that has a very slight, profit, you'll be drowned. They will take over the hospital. Thank you.
Thank you so much, sir. Thank you so much. Very well. So let's put our hands together. Let's put our hands together. Interestingly, the banks too are here. So we're going to hear from the banks in a bit. It's such a well-rounded discussion. I believe this is one of those very, very opportune moments whereby everything just comes together beautifully. So I'm going to hand over yet again to Mrs. Rita Chukwu. Dr. Godwin always has a way of directing the conversation to you. So please, if you do not mind, in the next 2 minutes, if you can, I would like you to speak to what exactly we can do better in terms of public-private partnerships. That whilst the government, yes, is thinking of ways, exploring opportunities of improving access, quality, and all of these things, how exactly do you think we can ensure we're able to build the right synergy between the public and the private space?
I would like to first of all talk about the actual wahala that we see every day. One was mentioned by Dr. Adiolo, right? Kunle. We are talking about the health facilities, the places where you open hospital. NHIA, we are suggesting that hospitals should merge. You don't have the capacity financially to set up a hospital. We have gone to different places where you want to go and do investigation for either accreditation or reaccreditation of a facility. And we saw the delivery room. We saw everything there rusted. We saw that they hung they did blood transfusion overnight, and then the remaining thing, they left it there till the next day that we came. The whole facility was terrible. And we were wondering, when and how will a human being come into this facility? So I'm using this opportunity, if you are somebody from a hospital here, or you're an owner of a hospital, and your hospital is not up to standard, please try and merge with others. NHIA is also pleading with HMOs. If you know you don't have the financial capacity, you can merge. The new operational guideline, you will see that the capital base has increased. It's when it comes out, we all see it. So we need to merge. You can't do it. So why are you trying to show that you can do it? You can't cope. Why are you trying to show that you can cope? If you look at some of the streets in Lagos today, you will see like maybe 3 hospitals in one street. You go to those 3 hospitals, they are not looking healthy because they can't cope financially. So hospitals, we are pleading with you. You can merge. Then talking about the premium, you saw me smiling. My background is actuarial science. I've worked in insurance companies. I'm a chartered insurer. And actuarial science is risk managers, and we calculate premium of insurance. And you realize that most HMOs, they don't even have actuarial reports to fix their premium. And when they do, they go beyond what the actuary has advised. Alexander Forbes, HR, and Mr. Kaise. We have worked with Alexander Forbes in my former place of work. And we see issues. Actuary is advising you, minimum plan, charge probably in those days, charge 30-something thousand. And you're saying, no, they can't pay. Let me charge 18,000. What do you want the actuary to do? He has given you his advice. He has submitted his report. But it's now up to you. Even in NHIA, there was a hospital, a HMO, I was working on their file. And then it was Dr. Hope that was the GM of Technical Operations Department. And I wrote, I said, sir, these people, look at the actuarial reports that they got from the actuary. And they want to give different plans, 4 plans. And the minimum, the actuary said, charge minimum 33,000. And they are charging 13,000. They've taken away 20,000. And we had to write to them. So what am I saying? You are the one complaining of finance. You are the same one reducing the amount that has been advised for you to take. When it came to capitation NHIA, people were saying 750 is too small, 750 is too small, make it 1,000, blah, blah, blah. Yes, there are some facilities that actually is very small. But when states came up, why did you, let me not say you guys, why did we agree to that amount? Why? You're already complaining of 750 capitation from NHIA. However, the benefit package is different. So I will also say that it's also good. Why I say it's good is look at the population, because that's what our state is looking at. States insurance agencies nationwide, they are looking at the population in the states, and they are really doing a lot. If you listen, if you are part of their engagement, stakeholders engagement and all that, you see that they are doing a lot. They are getting more people enrolled because the act is now mandatory. So financially, I would say have patience. Very soon, that 400 naira you are looking at, by the time you get the whole population of Nigeria, of Lagos State, I'm giving for instance, we have over 20 million. Let's even say 20 million. If you can get maybe 1/10 of it in your coffers, times it by 400 is a lot of money. And as an actuary, I would say as an actuarial scientist, you can't get everybody coming to the hospital at the same time, the same month. However, you are being paid per month. So when we look at the finances, yes, I know financial capacity of hospitals, of HMO is not really so nice. But don't look at it as today. Remember when NHIA came on board, a lot of hospitals refused to register with NHIA. It was free then. They refused. They felt that it's a government agency. Nothing can work. It can't work. But it's working. So health, state insurance agencies, don't look at it that it's 400. I plead that just look at the future. The future is greener. The future is better. What we need to do is to ensure that we talk to our brother, our sister, talk to your neighbors, talk to people around you to go and take up health insurance. And even in your hospital, in your facility too, please treat people well so that they can speak well of the health insurance industry. If you don't treat people well, if you keep telling them when they come to your hospital, you keep telling them that, it's just 400 naira or it's just 750. What will 750 do? And they have it in their mind that it's 750. How can NHIS pay 750, 750 naira for me? And then they go out and they say they are not doing health insurance again. You are also creating challenges in the future. So let's treat our enrollees well. I know I'm not saying there's no challenge financially. There's huge challenge financially. Even in NHIA too, we're also doing a lot to ensure that more money will enter, and we are working on our toes. Like I said, we are doing so many things. Then when you talk of public and private partnership, is very, very important. Very, very important. Because now the act is now made mandatory. The private sector, you can't do it alone. You must work with the government. Government policy is encouraging the private sector to come on board. NHIA too cannot do it alone. There are a lot of things we outsource. Like the state now is being outsourced. The state too is meeting with not only general hospitals, not only primary healthcare centers, but also private hospitals. So when you look at it in wholesome picture, you will see that all of us, if we can do our parts well, if we can play our parts well, we'll be able to move this industry forward. And the challenges that we are facing now will be fizzling out. We are not promising that it will fizzle out immediately. It's a gradual thing. And with this kind of stakeholder engagement, with the discussions, with all the things that people are working on, NHI is working on, the hospitals are working on, the HMOs are working on, you will see that gradually we'll have a better healthcare service delivery in the country. Thank you.
Thank you so much, man. That was so very well said. It almost seems as though we can end it on that note, actually. I have used up all the time that I have. I think I just have 1 minute left. But I want to give everyone an opportunity to just give their final words. If there is a lingering thought that you still want to just say as possibly a punchline just before we wrap up with this conversation. Now, my assumption is that across the audience, it's possible that your questions have already been answered by these expert panelists that we have put together. And so I'll just leave them with their final words. Mrs. Rita, if it's okay, I can start with you. Your parting words, if that's the best way to put it.
Okay, my parting words is implementation is the key thing. We can talk from here till tomorrow. We can brainstorm and bring all ideas, strategies. If we don't implement the actual thing that we are supposed to implement, we'll still keep on going backwards. But if we can implement a lot that we have said, a lot that you know, and all that is in our operational guideline is in the act, you will see that this healthcare industry will keep moving forward. So my final note is saying thank you to THT for this wonderful healthcare provider forum. I hope and I know that everyone out there, everyone here will be able to do their own parts. We all have a part to play. If you are not a healthcare provider, you are not an HMO, you are an enrollee. And all of us must make sure that this thing works. Thank you.
Thank you so much, man. Let's put our hands together. All right, Dr. Godwin, your words.
Yeah, I think it has been a nice discussion. We've learned from each other. And my advice is that health insurance is the way to go. People are going out of this country because of the health insurance over there. And my advice to the government, I still say it, I will still say it tomorrow, is that if they bring out a policy that will drive Nigerians into registering for this health insurance, they should do something that they did in BVA. They did something in NIA. You cannot do this unless you have this. You cannot do this. You find out that majority of people who are capable, who are paying out of pocket, will key into this health insurance and the number will increase. And for the health facilities, you must be able to judiciously use resources you have. We're not asking you to build an upstairs. What we are saying that let the ambience of the place we're practicing be very, very accommodating. If the hospital has dating patches, repent once or twice in a year. If the furniture is going, polish it, refurbish it, let it look nice and presentable, because the patients are coming in and they are ill. Some of them will walk away. They walk in and walk away. So people say, what they are giving me is not a report to HMO. It's because of the ambience. So people come and sit down and relax and wait for their turn. Some are uncomfortable when they are reception. They want to see doctor immediately and go. If you don't see doctor immediately, and our people do not communicate, please communicate. Engage the patient. Front desk, engage the patient. Talk to them. Oh, madam, please, just a few minutes, doctor will see you, and you go back. Communication is the key. Do not be there as a robot. You must talk to someone. Thank you very much.
Thank you so very much. So let's put our hands together for Dr. Godwin. So, Dr. Augusta, your final words.
Okay. My final words I'll party with are these. Please get yourself abreast with policies. There are new policies that come on board. Ensure you get to know about them, read about them. Also have audits. Audit yourself. Where did I start from? Where am I now? Where am I going to? So in the light of that, I will counsel, always reinvest. Don't use your money for parties, jewelries, clothing, travels. Reinvest the money into the facility. Make the facility better. Give the facility a facelift. Change those best spirits. Do artworks on the walls. Buy new air conditioners. Look at the horticulture of the environment. Plant flowers. Make it look beautiful. Let the place be catchy. Make it look children, adults, elderly friendly. Get beautiful staff who are polite and neat. Yes, I don't employ ugly staff, I'm sorry. Get beautiful staff who present themselves neat with good heart to attend to patients. And then, please, always plan for tomorrow. Always have something to keep for tomorrow. The dollar is increasing. What you were keeping in the bank yesterday is not valued today as same as yesterday. So know that times are changing. We are in a hyperdynamic country now. So plan for tomorrow. Make adequate plans for tomorrow. Once you are able to do that, then when augmenting becomes 50,000, you can always fall back and get it and still move forward. You will not be shocked. And then the patient will get the best. You too, you are happy. And then somebody will still recommend you to another person. And always remember, you can always and you can still be a patient. Thank you.
Thank you so much, Dr. Augusta. Let's put our hands together once more. Dr. Kunle, your final words. I know it might be a little difficult, but please help.
Thank you so much. I'd like to say this, and this is to the private practitioners. There is money in healthcare. In fact, healthcare is one of the biggest business world over. If you notice, the big boys are coming into healthcare. They are building hospitals, they are buying the HMOs, they are buying the diagnostic centers. It means that there is money in healthcare. And except we begin to key into it, they're going to wave us away. Even though the doctors are moving out, they will go to where they're going to pay them better. All the doctors, half of them are in Lagos. They will be in hospitals that can pay them more, and those hospitals that cannot pay them, they will not pay them. So what am I saying? I have what we call the theory of growth, which I use. And that theory is that if I continually bring in new patients, and I take care of the patients that I have through excellent customer service and hotel medical care, I will grow. If I bring in new patients and I maintain the one that I have through excellent customer service and hotel medical care. Hotel medical care is that my hospital should look like an hotel. The best care, and when you are there, you are satisfied. I will grow. And I'm employing every one of us, please, do you have people that are bringing in new clients to your hospital? Do you have a marketing unit? Do you have a customer service unit? Do you have a medical unit that is giving standard care? So you must segment your practice and continually bring in people. The people are there. The population is there. Anywhere in the world where you go, we have the population, and the people will be sick, whether you like it or not. When they are not sick, you provide preventive care. So you have the population as your market. Tap into them. Bring in new people. Maintain the patients that you have under no condition. Should a patient come to your facility and complain that he's not satisfied, that is your fault. If you continually bring in new patients and maintain the ones that you have, you will grow both financially and numerically. Thank you.
Thank you so much, Dr. Kunle. Thank you so much. Thank you so much. And on that note, I believe that we can bring this panel session to a close once more with a resounding ovation. I want us to thank all the panelists for coming and for lending us their thoughts. All right, thank you so much. You can make your way now back to your seat. Thank you so much for joining us. Let's keep clapping, please. Let's keep clapping as they return to their seats. All right. I believe at this point we would like to take a few guests that will be sharing with us some bit of information. Remember that we said earlier that even the banks are here. I should move this forward. All right. I have been informed by the team that it's to our advantage that we take a picture together to, commemorate this conversation that had just concluded. And so I am pleading with the panelists to please return and also to have the attention of the COO on stage, and let's take a picture together just to have it cemented that we had this momentous conversation on this day. So please, let's have the panelists back on stage, and then we'll just stand and take a picture together. All right, thank you so much. Thank you so much, everyone. Thank you once again to the panelists and to my CEO. All right, so at this point, I will like to call up the representatives of the Stanbic IBTC. I believe that they are with us, and they will like to share with us some bit of crucial information. Please, can I get some assistance in moving this back forward? Let's put our hands together as I welcome on stage Jane Ike Okoli.
Thank you very much. Standing on existing protocols, thank you very much for having me here and Stanbic IBTC. My name is Jane Ike Okoli, and I am the head of specialized sectors. Now, specialized sectors has number one, healthcare sector, and then it has other sectors, renewable energy, and the rest of them. So I sat back there and I listened carefully to the great panelists, and they were hitting all the points that were very important. Healthcare is so important, and I always ask this question, and I say to people, if you're asked to choose between food and health, which one will you choose? If you're asked to choose between food and good health, right? Which one would you choose? Thank you. You guys are awesome. And I tell people that if you are not well, you cannot eat. And if you don't eat, you can't survive. Right? So what this means is that healthcare sector should actually be the #1 sector in this country. Whether people like the oil and gas sector likes it or not, that's their business. People can say, oh, our Greek, that's their business, but healthcare sector should be #1. And because we recognize the importance of this sector, Stanbic IBTC has decided to differentiate itself and also making healthcare a focused sector. What does that mean? It means, how do we provide solutions to deal with the challenges that the healthcare sector has? How do we provide challenges to deal with the challenges that the healthcare sector has? Now, just to give a bit of background, I can't see my slide, but you can just go quickly to the first slide. Just to give a sense of how Stanbic IBTC is well positioned to deal with the healthcare sector. Now, Stanbic IBTC, all of us know that it's a member of the Standard Bank Group, and what that means is that our presence in African countries is stronger than every other bank that you know. That's #1. #2 is that for Stanbic IBTC, we're not just looking at your business, we're looking at everything that has to do with your business. We're looking at your employees, we're looking at how do you put your assets under a trust. So we've got Stanbic IBTC Bank, which is a subsidiary of Stanbic IBTC Group. So you have Stanbic IBTC Bank, Stanbic IBTC Pension, Stanbic IBTC Asset Management, Stanbic IBTC Trustees, you know, and the list goes on and on and on, even up to Stanbic IBTC Insurance. Why? We've decided to position ourselves as the all financial services institution. Again, we are partnering with, THT, and that's because when we're choosing our partners, we're very careful. We're looking at their strong record and all of that, competence and things like that. We have seen that THT is well positioned. They've gathered a very strong reputation over the years, and we're partnering with them. How are we partnering with them? We have created solutions for all the providers that are under THT. What kind of solutions? First, the lending solution. Let me start with the lending solution. Now, we know that healthcare financing is actually one of the biggest challenges that the healthcare sector has. How? First of all, the federal government allocation to health over the years has not exceeded 5%. Can you beat that? That's to tell you the kind of negligence and the kind of little attention that the sector is getting. Now, the federal government cannot do everything, which is where the financial institutions should come in. How? By providing financial solutions, especially healthcare financing. All right? So, in terms of lending, we've come up with different solutions, both short-term, medium-term, long-term, depending on what you want to do for your healthcare business. One of the panelists I was listening very carefully was saying these are the things you need to do to make sure that your healthcare business is top-notch, looking good, attracting patients and things like that. One of the ways you can achieve that is by getting some sort of financial support. I know what the concerns are. The federal government, would I say they've done their best? Well, we're getting there. It's a journey. They've come up with healthcare intervention funds and all of that. But guess what? It's not enough. The financial institutions will need to also play their own part. So in terms of healthcare financing, one of the recent solutions that we came up with is where a healthcare business can actually get 10 million naira with zero collateral. So we know what the normal health, financing does. But then, they always tell you, bring an arm, bring your leg, bring your heart, bring your kidney and give to the bank before you can get some sort of funding, right? So we said, okay, let's cut it down into a small size where we can give 10 million naira, do not bring any collateral, please just go and provide quality healthcare services and then repay the bank so you can build your own strong reputation. All right? So the short-term healthcare solution is there. There's also medium-term, and and the list goes on and on and on. Now, for the ones that are not short-term, that is 10 million naira, above 10 million naira, we will definitely be asking for some things because the amount is quite bigger, right? But then we will assess your business and all of that. Now, one of the things that we've decided to partner with THT on is what we call invoice discounting, where you will provide the healthcare service to the patients under THT, and then the bank gives the fund or makes the payment 80 to 85% of that payment to the hospital, so that when THT finally pays you, everything's just sort of balanced out. Now, the essence of that is we understand that you need to run your business. We understand that you need to pay salaries. We understand that you need to expand, renovate, do all of those things that would make your business, look good. So, whilst waiting for THT to pay you, the bank has partnered with THT to avail you a facility that will be 80 to 85% of the, the equivalent of the service you've provided to patients. So we're still, going to give you the fine prints and the details of all that, but that is one fantastic thing that we're bringing into the sector. Courtesy, Stanbic IBTC and THT. We're already, putting down and laying down the guidelines, and that will be communicated to anyone who, should be interested. Now, at the end of this forum, we're also going to be getting details of anyone who is interested or any business who is interested in that. We would also be getting all your contacts, your email contacts, so we can send you information on the things that you can access, so you can get your healthcare business to that level where you want it to get to. Now, the other things that we do for Stanbic, for healthcare businesses are your digital payments and collections that we can help you manage. Now, we understand that maybe about 90%, and one of the panelists said it here, healthcare insurance is not where it's supposed to be. Not a lot of people have access to healthcare insurance, so we understand that a lot of out-of-pocket payments happen in the sector where people will come and they are required to pay out of pocket because they don't have, insurance. So whilst we're still getting there, getting to that level where we can say there's some level of access to health insurance, we sort of deploy our payments, digital payments channels like the POS, deploy our online payment service and things like that. So these are the things that we've also come up with. So there are two ways. Let's just categorize it: lending, and then payments and collections management for your business. Now, lending, remember, is in partnership with THT under the invoice discounting solution. All right? So we are prepared. We're here to stay. We're not going anywhere. We have a slogan that says, Africa is our home. We drive our growth. And for us in Nigeria, we say, Nigeria is our home. We drive our growth. Let the people who want to japa keep japaing. We're here. Yeah? All right. So, I mean, apart from this, and the last thing I just want to say, before, you know, if you have any questions, I'm sure the moderator would sort of get that together. Employees are the greatest assets of any organization. Your employees. It's not your whatever. It's not how much you have at the bank. No. Your employees actually get your business going. One thing that we have also done is that we have what we call employee value banking. Now, one of the reasons why you're hearing that there's a high rate of capital flight in the healthcare sector is because people want better lives, right? They're seeking greener pastures. What is a better life? I want to live in my home. I want to drive my own car. I want to have assets. I just want to live comfortably and make my family comfortable. That's why most people are running away. They're not getting that kind of life. So what is Stanbic IBTC doing under the employee value banking proposition is to create different kinds of facilities that your employees can access. Right from getting a home, to getting a car, to getting just a little personal loan, to take care of your, you know, any project that you have, to getting things like easy cash that you can access from your phone within 2 minutes, and the money is in your account. So these are the things you should actually be positioning to your employees in your healthcare business. And when you do that, your employees are happy. A happy employee is a productive employee. All right? So these are the things. And then maybe just to close out, please, I would advise every healthcare business get a business development strategist. What do I mean by that? Now, I'm a banker, and I can tell you that one thing they know bankers for is their targets, right? I have a target. I've not died, and I'm meeting my targets. All right? Now, the same thing is not just for a bank. Why banks are making money is that you have put a development strategy, a business development strategy in place to see how they can grow your business. The same thing for the hospitals. Please, don't just let people sit around. There has to be a strategy session where you will say, this is our business strategy. This is how we want to grow our patient number from this to this to this. Every year, your patient number just keeps rising, right? So it's very, very, very important. Please, financial management, business strategy management is also important in the healthcare sector, not just the banks. How can I grow my business, my healthcare business? It should be part of everybody's mind as you live here today. Because as you grow your business, you attract more banks, or you attract a bank to want to support you, want to partner with you. So, I mean, thank you very much. I hope with these very short words of mine, it's been valuable. My name is Jenny K. Okoli. Stanbic IBTC has a table at the back of that place, just at the back. If you have any questions, you want to drop your card, you want us to reach you, please drop. My colleague is Tunji, is there, he's waving. So please, you can just meet him at the back. Thank you very much.
Let's put our hands together. It has indeed been a very rich forum. And that goes without saying that if you have any questions, they are more than capable to listen and to be able to address your concerns. So please kindly locate the Stanbic IPTC stand at the end of the auditorium subsequently, so that we're able to take questions and concerns or contributions that you want to make to that conversation. I believe that we also have a team from the risk and compliance team in THT that would like to address very quickly in 2 minutes to just highlight a few things that we believe are important and touch points as it pertains to data protection and patient information management systems. Let's put us together for the Tunde Vote.
Thank you, Timilein. And good afternoon, everyone. I will write on the existing protocol as well. And then I believe that a lot have been said this afternoon. But then we also have the mind that we need to be on the same page we being compliant to data protection, we want to encourage everyone seated in this auditorium also to ensure compliance. I want to say this, that we all operate in a regulatory environment, and therefore it's called for every one of us to ensure compliance. So I won't want to take much of our time. I have a slide, but then, like I said, I don't want to take much of our time. That will take run to probably 15 minutes, but then I want to cut it short to ensure we don't take much of our time. We are all aware that as we are seated here, a lot of our informations are in the digital space. Some we have control over, some we do not have. And that's why you get some unsolicited messages, emails. You wonder how your information got to the hands of people sending you this information. But then, the world is no longer dynamic. We heard this afternoon that is now hyperdynamic. So it means that the speed at which the global village that we envisaged since a few years ago is moving is not the speed we actually anticipated, but then is beyond what you and I have control over. And in that light, it is our responsibility to ensure that since we are compliant with the regulatory provision, we want to encourage everyone, every organization seated here, every providers as well, to ensure compliance. As we are data controller and you are data processor, likewise, we are also one way or the other a data subject. I hope we all agree with me that one way or the other we are all data subject. And then, like I earlier said, our information is in the space already. It's everywhere. So I don't know if my slide is being projected. I don't know. Can I? It's being projected. Okay. So as mentioned, let me say the scope of the NDPR Act. One moment, please. So the Act applies to the processing of personal data, like I earlier said, and whether it's been automated or the one you filled manually. The NDPR is to safeguard our information. And then, as a data subject, every one of us, we have data, we have rights to our data. If you don't want to give your information to anyone, nobody will force you. But what will force you, will definitely force you. You can't go to a provider and you want to get a quality health care, and you say you don't want to give your data, you don't want to give your information. So how will you assess that? So it's a mandatory thing that our information, whether we like it or not, we still need to share. So the Act gave room for people that are data controller, like Total Health Trust is, we are data controller, and you, the providers, one way or the other, you are a data processor. I hope we are all aware of that. And then I want to quickly run to the benefit of data protection compliance. Let me just make it as brief as I can. The benefit. Individuals have control over their personal data. Like I earlier said, you have control over your personal data. Improve trust. Your compliance as an organization improve trust. It gives a level of confidence to whomever that wants to visit your facility for health care. Once they know that their data will not be compromised, that a Yahoo boy will lay Okay, let me cite an instance in which a data or a file was not being handled well, and then you see some papers, maybe by the time you buy akara or any other things out there, and you see result of WAEC students flying all over, and you wonder how come this came out. It means that the organization or whoever, the agency that was in charge of that responsibility was not handling the data very well. If you are the data subject, if peradventure you are being sold an akara and you saw this kind of paper, you can sue that institution. You have the right to sue that institution. And more so, the reason why we want everybody to be on the same page to ensure compliance is that to create synergy within TAT and each provider seated here. We want to ensure that you are not being fined by the regulator. There are fines. There are fines to pay. So I want to ensure your compliance as our own compliance as well. And that's why this a kind of awareness training this afternoon, to make sure that you are living here, if you are not already compliant, that you ensure you do the needful, you do the right thing to ensure compliance. The fine is, well, I don't think anybody will want to just part with 2% of his annual previous revenue, or a 10 million, whichever one is greater. I'm not sure anybody wants to part with any of such. So it's good for us to bring the awareness to every one of us to ensure that you and TAT, we are all on the compliance level. Another benefit of being compliant is the provision of job in data protection and related career. Comprehensive international trade from implementing global best practices. Increase in GDPR, those are the benefits. Like I said, I don't want to take much of our time. Let me just go to the importance of privacy. So it preserves the trust of citizens. By the time you are able to keep information of your enrollee or whoever is the patient that come to your facility for one treatment or the other, this will, it will enhance the trust. I can just refer people to you and say, okay, that facility there, well, it's a top notch. You won't regret going there. But by the time your information or people's information are being compromised, they are seeing it outside there, you are not keeping your folders very well, medical folders. Imagine if it's an election period and then maybe a candidate, his medical record is flying all over. I wonder what such a candidate can do to any such organization if at the end of the day it's been determined that, okay, the medical information actually leaked out through our facility. Another importance of privacy is the mitigation of risk, both legal, financial, and your image, which is very crucial. I don't think even Total Air Trust we want his image or reputation being damaged. It's been built over some years back, and I don't think my CEO will wish to relate or want to dine with somebody who would just divulge information anyhow. What I'm trying to say is that integrity of information is very, very important. So let me just rush and just give us the type of data that are under data protection. Sorry, Timile, I will just quickly run over this. I know. Okay. Just to give us a little brief about what person. Okay, we all know personal information, personal data, which are your patient's name, their location, identification, their ID, their address, and even the cookies that have been managed by you using computer. You know, some sites, by the time you are visiting some site, they will tell you, except you accept cookies, you won't be able to proceed. So we have some sensitive data which are health record, like I earlier mentioned. You have race and ethnicities, political opinion, and sexual information like that. Let me just rush down and well, I just want to jump to why, as an organization, as a provider, we need to ensure that each one of us, we encourage ourselves and have a DPO. We have a data protection officer. It is very, very important. Most of these things they will be able to give an awareness about, and things that need to be done on a timely basis, they will be able to ensure that these are done. I'm being given signs that my time is up, even though I won't be able to run through all the slides. But then, I'm encouraging us this afternoon that each and every organization or each and every provider here present this afternoon need to be NDPR compliant. Thank you and good afternoon.
Thank you very much. Let's put our hands together. All right. We have gotten to the point wherein we want to appreciate everyone for waiting behind, and I'm going to hand over to the delightful for me to help to close this out. We're going to do a bit of a raffle draw, and then there will be some prizes presented. Over to you, Fami.
Thank you. So at the entry point, we picked up a little paper. Please come up, Ekemini. Thank you. Please let's give her a round of applause as she comes off stage. We picked up a little paper at the entry point, and so this is the point where that paper will be needed. So I'm going to pick any volunteer from the crowd who would pick up any of the pieces of paper here, and you know, we have lovely prizes to be won. So if your number tallies with the number that the volunteer would read out, then you have won something. And also we have prizes for the online participants as well. So please, if you want to volunteer to read out, thank you. Please come up stage. Let's give her a round of applause as she comes up. We'll still need one more person later. Okay. Here, a mic.
Good afternoon, all.
Good afternoon. Please, what's your name?
My name is Ijoma
from
Johnson, Ayodele Medical Center.
Okay. Thank you, Ijoma. So please, as you pick, you read out. You're going to pick 4 papers, but pick and then whoever wins will come up stage. Okay, you're holding yours. So please.
In Jesus' name.
I can feel some people's hearts pounding at this point. Yes, please read out.
Okay. I have 1105.
1105. 1105. Wow. Sir, are you 1105? Please come forward.
Oh, congratulations.
Let's give him a round of applause. Please just come forward here and you can just wait here. Yes, we need to confirm.
My neighbor.
Oh,
see
wow.
why I like? Oh, congratulations.
Okay, so without wasting much time, let's pick another one. We're picking 4.
Sorry, the tribunal, his is 1005. The number actually is 1105. Sincere apologies, sir. So 1105. Are you in the hall or do we move? Is there anybody with 1105?
1105.
Going, gone. Please pick another one. All right. The person has come out. What happened? All right, so 1105 is here. Let's put us together. Congratulations.
Congratulations.
Please pick another one.
Blood of Jesus. Okay. 1107. 1107.
Let us shuffle this thing very well.
Praise the Lord. Please don't miss my order.
Okay, yes. You can just stand here. So we're going to the next one. Please, let's shuffle it very well. That's why it's a raffle draw.
Holy Spirit, come. One 1076. 1076.
1076.
Anybody in the house? Oh,
Please come
congratulations.
Let's be happy for those that are winning.
Oh, Holy Ghost now. 1229.
1229.
1229.
Please check your papers well.
Somebody's coming.
1229.
Someone is coming.
Oh, someone is coming up. Let's give him a round of applause, please. You might just be the next winner.
All right. Yes, that's mine. Thank you.
All right, thank you. Let's put hands together for the volunteer. Sorry, let me just quickly confirm, sir. Let's be sure what is on the IRA. Okay, so it's correct. It's 1229. Thank you so much. Congratulations, sir. So can we have just one more volunteer, possibly male this time, for equity? A male volunteer to pick for us. Let's put hands together for him as he comes up. So we still have 4 more to go in this hall, and then the remaining 4 will be for the virtual audience. Welcome, sir. Sorry, introduce yourself.
Okay, my name is Elijah from Boost Opticals, Aja Axis. Thank you. We have 1, 2, 3, 5. 1, 2, 3, 5 number.
Oh, wow. Please, let's celebrate him. You know, as they say, when you celebrate a person, your time will come. Oh, thank you. Okay. So we're going to do the presentation now, and we'll go forward. Please, you can just sit. So please, let's call on our COO for Total Health Trust Limited. This is a present from the COO from THT to say thank you to the providers to present this gift.
Thank you very much. So my colleagues will help hand out the gifts. Bimbo is our head of internal audit, and Larry is our chief financial officer. So please, let's hand out the gifts to the winners so that we don't keep them standing. Just pick.
All right. Good afternoon, everyone. I'm so excited. I didn't expect this, though. My name is Joy. I'm from Ceylon Dental Clinic, Ibejule Kiazes. And I'm very happy that I'm part of the lucky ones to win this beautiful prize right now. Thank you so much to THT.
Thank you so much. My name is Donald Amadi. I work with Grover's Hospitals in Victoria Island, a multi-specialty hospital.
Okay. Thank you very much, THT. In fact, I am so delighted. My name is Frank Kaihion. I'm a pediatrician, and I work with Excel Children's Hospital. I remember sitting just at the back, and the person behind me said, I can't wait for this lucky dip. And I told her, you're coming right behind me. And she said, no, you will come behind me. So my friend out there, you can see I'm here. Thank you very much, THT.
Good day, everyone. My name is Oluwatmiro Vera. I'm representing the Redeemed Medical Center, Okoko. I'm very happy to be in your midst today. In fact, I've never expected this. I want to tell THT, thank you. It's nice doing business with you.
Good afternoon, ladies and gentlemen. My name is Robert Osovase. I represent Richmond Dental Clinic, Ikoyi. I have been attending THT Provider Forum for years now. So I would like to say today is my Emilocon. It is my turn. And I'm very happy, and I'm saying a very big thank you to THT. Thank you.
Thank you so much. We have 3 more to go.
All
Three
right,
more
Dr.
to go.
Okay.
So please pick a name, a number.
Okay, here we have 1192.
1192. 1192.
Oh, congratulations.
Please, let's celebrate her. She comes forward. Stand here. And pick another one, please.
Okay, here we have 1267. 1267.
Let's celebrate him.
Congratulations.
Let's pick another one, please. Which is the last? The last but not the least. Fingers crossed.
And the last but not the least, number is 1057.
1057.
The last man or the last lady standing.
Please, let's celebrate her.
1057. The last lady standing.
Thank you so much. All right. Thank you so much. Thank you. So just your name and the way you're from.
Okay, my name is Kunle Afunsho from Living Arts Specialist Hospital. We are in Lekki. I'm glad to be in this very August occasion of THT Providers Forum. And all these years, we have not been privileged to win any of the gifts. But this year, I think, as the other candidates say, that this is a Milocon season. I think it's also our time and my time. And I'm very glad and I appreciate THT for this gesture. Thank you and thank you and thank you once again.
Thank you. Please, just your name and where you're working, please, briefly. Thank you.
Good afternoon, everybody. My name is Chika Ibekwe from Robert Dental Clinic, Surulere. Thank you.
Thank you. Your name?
My name is Titilayo Bashir from Viewpoint Specialist Eye Center, Muritala Mohammed Way.
Thank you very much. Congratulations. Thank you very much to everyone for coming. I hope it's been 4 hours of time well spent. And like we said, we know times are hard. Things are changing rapidly. But I think the key is for us to collaborate and collaborate. So thank you for your partnership. And see you when next you see our members. Thank you very much. Have a wonderful trip back home. Bye.
Hello.
Who is in charge of these lights?
Hello.
There.